Senhoras e senhores.
Ladies and gentlemen, once again, we wish you a good morning. We'll be beginning our ceremony. We ask that you take your seat, accommodate yourselves, remembering once again that you keep your electronic devices on mute. Thank you very much. We begin the Global Conference on Climate and Health of 2025. We invite to compose the table the following authorities: the President of the National Council of Health Secretary CONAS, Tânia Maria Coelho. The President of the National Council on Health, Fernanda Maganho. The Secretary of Vigilance in Health and Environment, SVSA, Mariangela Simon. The one in charge of business of Spain Embassy in Brazil, Juan Escobar Esteban. The Council Minister of the United Kingdom in Brazil, Tony Kaye. The CEO of COP30, Anna Tony. The Director of Adaptability Convention Board of United Nations on Climate Change, UNFCCC, Youssef Nassef. The Director of the Organization, Pan-American Organization of Copas, Sharbas Barbosa. The Ministry on Health and Social Action from Senegal, Ibrahim Massi. The Health Minister and Health to Antonio Habis. Lala Balavu. The State Minister on Environment and Climate Change in Brazil, Marina Silva. The Minister of State on Health, Brazil, Alexandre Padilha. At this moment, we invite all for standing to listen to the execution of the national anthem at the voice of the Lady Teresa Lopez.
Mirando Ipiranga, as margens plácidas de povo herói com brado retumbante, e o sol da liberdade em raios fúlgidos brilhou no céu da pátria nesse instante. Se o penhor dessa igualdade conseguimos conquistar com braço forte, em teu seio, ó liberdade, desafio nosso peito à própria morte. Ó pátria amada, idolatrada, salve, salve. Brasil, um sonho intenso, um raio vívido, De amor e de esperança a terra desce. Se em teu formoso céu risonho e límpido a imagem do cruzeiro resplandece, gigante pela própria natureza, és belo, és forte, impávido colosso. Se teu futuro espelha essa grandeza, terra adorada, entre outras mil és tu, Brasil, ó pátria amada. Dos filhos deste solo és mãe, gentil pátria amada, Brasil. Deitado eternamente em berço esplêndido, ao som do mar e à luz do céu profundo, fulguras, ó Brasil, florão da América, iluminado ao sol do novo mundo. Do que a terra mais garrida, seus risonhos lindos campos têm mais flores, nossos bosques têm mais vida, nossa vida em teu seio mais amores. Ó pátria amada, idolatrada, salve, salve. Brasil de amor intenso, seja símbolo, o lábaro que ostentas estrelado, e diga ao verde louro dessa flâmula, paz no futuro e glória no passado. Mas se ergues da justiça a clava forte, verás que o filho teu não foge à luta, nem teme quem te adora a própria morte. Terra adorada, entre outras mil és tu, Brasil, ó pátria amada. Dos filhos deste solo és mãe, gentil pátria amada, Brasil.
Senhoras e senhores, podem...
Ladies and gentlemen, please take your seats. We've registered the partnership and the support of Spain, United Kingdom, Foundation Gates, Foundation Rockefeller, Wellcome Trust. We've registered the presence of the following partners: Coalition to Continuity of Presidencies on COP of Baku over Climate and Health, the Organization of Health, OMS, Meteorologic Organization of the World, OMM, Program of United Nations for Development, PNUD, Organization Pan American Organization of Health, OPAS, Osvaldo Cruz Foundation, Fiocruz, United Nations Program for the Environment, PNUMA, and Board Convention of the United Nations over Climate Change, UNFCCC. Our thanks to the international organizations and multilateral banks of development, researchers, academic over climate, environment, and health, formulator of policies from the health ministries, authorities, and civil society representatives, base movements, philanthropic associations, and high-level representatives of indigenous and traditional communities. It's with great honor that Brazil hosts the 5th Conference on Climate and Health. The event is organized by the Health Ministry in partnership with the OMS and the Pan American Organization on Health, OPAS. It counts still with the support of important partners like Spain, the United Kingdom, the Gates Foundation, the Rockefeller Foundation, and Wellcome Trust. The conference also establishes the annual conference over Alliance for Transformation on Climate and Health, TACH. This important dialogue space is aligned with the development of a action plan for Belém, a Brazilian proposal that will be presented for the adherence, a voluntary adherence during COP30. The plan integrates the Acts 5 of the conference, the promotion of human development and social and human development, especially the 16th goal, the promotion of health service who are resilient. Belém plan aims to approximate scientific evidence and intersection nation reports to officiate and establish great communication. It's so about the development of the main objective of the conference is to consolidate and disseminate knowledge over adaptation policy, over health to climate change, highlighting the benefits of climate actions for equality over different levels of governance. The event also aims to mobilize the support of philanthropic foundations, multilateral banks, and climate funds. The facing of financing over climate adaptation and health. Put equity on social participation at the center of this agenda is essential to propose change and strengthen the role of health on the COP30 negotiations. We invite to welcome the Secretary of Vigilance in Health and Environment, SVSA, Mariangela Simão. Thank you. Good morning, everyone. Bem-vindos.
Portuguese because we are in Brazil. And those who don't understand Portuguese, please use your headphones or learn Portuguese for the next by COP. Senhoras e senhores,
Ladies and gentlemen, be very welcome to Brasília, to the Global Conference on Climate and Health 2025, which is the biggest official event on COP30, pre-COP30, that's occurring on the world right now. It's with great honor to receive participants from many countries and our representatives from the government, international associations, civil society, academic sector, and local authorities. And we are all here because we have a compromise with climate justice and health equity. These are the two main focus. And as the head of ceremony has stated, and we will listen to it a lot through these 3 days, it's a headstone over the health plan of Belém. And why is it so important? Why are we bringing this event focusing over the different experiences that we'll have throughout this event, so that we may impose innovations and concrete compromises that may structure the way of health to COP30. So our desire of the government of Brazil is that we build transforming environment that connects people and ideas and that reinforces our compromise to public policies who are effective innovators and have social participation, because this is the brand of Brazil. And to finalize, just say that like never before, we see an interest on this conference and also on the health actions through COP30, that the future of health and climate are inseparable. It is up to us to pave concrete action that may help making the health system more resilient. Be very welcome. I'll stop here. Welcome everyone. In this moment, we'll watch a statement over the Principal Director of MS, Head, that is Adenom. Senhores,
Honorable Minister Lalbalabu, Honorable Minister C, dear colleagues and friends, bon dia and a warm welcome to all. I thank the government of Brazil for its leadership and partnership And I thank you, policymakers, health professionals, scientists, indigenous leaders, youth and community advocates who have come together at this crucial moment, because the climate crisis is a health crisis. Recent episodes of extreme heat in southern Europe and flooding in Pakistan and Texas are a demonstration of how climate change is both harming health and pressuring health systems. Poor and vulnerable communities are impacted the most. The Belém Health Action Plan, to be launched at COP30, can help provide a way forward. The plan, which WHO contributed to, provides guidance for countries in building climate-resilient, low-carbon health systems, protecting vulnerable communities, and embedding health in national climate policy and financing. As we look ahead to COP30 in Belém, this conference can be a springboard to build healthier, more resilient, and more equitable societies. To accelerate progress towards clean air, clean energy, nutritious food, and safe housing, and to reduce emissions and save lives. WHO is proud to support your efforts through the Alliance for Transformative Action on Climate and Health, the Baku Co-Presidency's Continuity Coalition, and our partnership with Brazil. Muito obrigado.
Convidamos para fazer uso da palavra a ministra de Estado do Meio Ambiente e Mudança do Clima, Brasil, Marina Silva.
Good morning, everyone. Firstly, I'd like to thank God for being here. I'd like to compliment my dear friend, our Minister of Health, Alexandre Padilha. It's an honor to be able to share with you of this moment so relevant to public health on the world, specifically over our country. I wish to compliment also Sir Javas Barbosa, Director of the Pan-Americana Organization on Health. I give my regards also to the Executive Director of COP30, Ana Toni, the one representing the Director of COP30, the Ambassador Anton Correia do Laço, event that we will be hosting here in Brazil. I'd like to compliment Minister and guests, and also like to thank all those who are here mobilized to debate such a relevant theme as it is the theme of health and climate change. This year, the conference had as theme something that's very promising and is not by destiny. It's about action and equity, thinking on public health, where every time we're being affected by numerous factors who alter the health problems. Climate change is no different. And beyond unbalancing the climate system, of compromising our food systems, our infrastructure, of altering vectors who augmentate health problems in different regions, including regions who didn't used to suffer such evils like those who are brought by the Aedes aegypti, and also others that we know are equally damaging to public health. So having a conference where we talk about climate, where we talk about environmental factors as a problem to health systems is something that we have as more need for. Climate, as I've spoken before, we have factors such as pollution, extreme climate events that end up being foster to even greater problems, being those who are caused by accidents, about floods, floods, dryouts. We have situations where it has been becoming more complicated every time. We've been living over the effects of the climate change. We're not living a situation of climate urgency. We are living a situation of climate emergency, a state of emergency. When we think that millions and millions, thousands and thousands of lives are lost each year due to heat waves, the data who is underlighted gives us ground that over 500,000 people every year lose their lives in regards to heat waves. If we had something that made this life loss due to war, and according to data, over 260,000 lives are being lost due to war. Of course, all of us, rightfully, looking at those scenes, get angry when we see what's going on at African regions, Ukraine, and at Gaza. But the silent war that's happening in regards to climate change that make children and moral elders lose their lives, this unfortunately cannot create a greater impact, and that is due to something that is this diffuse responsibility where you can't establish a direct person to give responsibility to. But every time we don't do our homework, in over 33 years we've been doing this debate since Rio 92, where it was diagnosed that if we didn't reduce the emission of CO2, the planet would overheat and all those problems would begin happening. If we had done our homework, we'd absolutely not have a great part of these problems would have been avoided. Unfortunately, those who paid the highest price are those who less contributed to the cause of the problem. The most vulnerable populations from unprivileged communities in our countries, the most vulnerable regions, the systems who collapses, food systems, sanitation systems, support systems, all these makes these communities who less contributed with emission be the ones who pay the highest price of the evils brought by the climate emergency. That not talking about local communities and indigenous community who on the contrary contribute so that we have a resilient relation towards nature to pay the highest price. In that sense, what I'd like to state here is that the question of health cannot be neglected anymore. The theme, the debate associated in regards to climate. We've had numerous events that had happened talking about this theme, and I celebrate the efforts and the gains that we are reaching each day and throughout every event. We were definitely able to take to our countries greater responsibilities. However, it's not enough that we can create and take care of the symptoms. It is needed to attack the causes. And here I excuse myself to talk like this because I know I'm before the people who are on health area, so I'll be very economic in regards to that. But absolutely, attacking the causes means to reduce the emission of CO2 that are caused over the use of coal and deforestation. Attacking the causes means taking care of the health of the world, because we have no way of taking care of our health on a fevered planet, and this fever has a name, this fever has a reason, and that is why COP30, we are making it so that it is, in the words of the ambassador Correia do Lago, a great group force, so that together we may make what needs to be done, meaning implementing the decisions that we've already taken over 33 years since we've established the great conventions on Rio 92. And what are the decisions taken? The decision taken is that we can't transpass 1.5 degrees Celsius over the temperature of the Earth. The decision taken is that we must make this implementation means easier to be accessed by developing countries. We also took in Dubai the decision of to make triple renewables the energetic efficiency, so that we may have the means to go away from fossils and from deforestation. So what we are doing is only if we do this in a planned way, if we prepare ourselves. President Lula has a compromise here in Brazil of zero deforestation up to 2030, and this was only possible to establish this compromise because we've planned ourselves. When he was president, the first time in 2003, we've had a plan that possibilitated that today we are able to take this compromise in zero deforestation, because in the past we got a reduction of over 80% less on Amazon, avoiding the launch of 200 tons of CO2 emissions. We've got a reduction right now of 46% of deforestation on Amazon and of 32 on the country, 77 on Pantanal, 25% on Cerrado. And this was only possible because there was an anticipated vision way back where we planned. The worst thing that we can do is not plan for change. When we plan for change, we get out of the risk of being forced to change. The worst thing is, instead of changing, being changed by the circumstances. And that's why, Minister Padilha, that I celebrate your effort and all the work of all the ministers of health and this alliance between climate and public health, because climate is overwhelming the health systems, and if we're not able to do our homework, this reality will only do us more harm. I conclude stating, instead of doing wars against one another, bellic wars, instead of doing tax wars one against the other, mining cooperation and solidarity spaces, we should be at war against severe health problems, against poverty, against all kinds of evil who are affecting humankind. This is the war we should be having, and not ending innocent lives and forgetting that climate change is our climate Armageddon. May we have a great encounter, and that we can live here with the hope that there are a lot of things, as says the poet, that they don't need a new path, they only need a new way to walk. And in the name of this new way of walking that President Lula has proposed alongside the Youth Secretary before COP30, throughout the mobilization cycles for COP, that we've had a ethic global balance, so that society could, in their different sectors, make an ethic balance. Philosophers, women, youth, black community, scientists, an ethical balance to show what's the need of what needs to be done, of what needs to be seized, so that we can create a new cycle of prosperity with sustainability and dignifying life to everyone with health and peace throughout the people and the planet. Thank you very much.
Thank you very much, Minister. Now, speaking, the President of National Health Security, Tânia Coelho. Good morning, everybody. I'd like to salute everybody, all authorities, uh, the Minister Alexandre Padilha, and our Minister Marina Silva, which I was really proud of to know that she's son of Cearense people, and I'm really proud to be like you, Cearense. It's an honor to speak in behalf of the CONASA in the fifth conference of climate health. I'm speaking as a public manager and infectologist doctor, but most of all as a citizen really moved by the reality that we are living in our country. The climate crisis is not something in the future. It is really something that we live in now. In the last years, Brazil has been being in extreme climate events with catastrophic regions. Floods in South Brazil, which we had more than 4,000 people moved. Drought in Nordeste in Brazil, Northeast Brazil. We have fires in Cerrado, Amazonia, with a lot of destruction. We have a lot of heat waves that in Brazil have been caused, uh, which affects especially the poor people. The infectological profile of Brazil are changing. Vector disease are spreading across Brazil. Floods are creating places for the chikungunya, Zika, and Aedes aegypti. Other diseases like
Had advanced to new regions. As it has been said by the Minister Marina, the climate change are ending aggravating the social inequalities. Facing the climate crisis on health demands good governance cooperation throughout all levels. Internally, we need a premurated federation cooperation, CONAS, along CONAS AMS, which is the National Council over National Hospitals. Health Ministry established a room of national cooperation over climate change to monitor real-time events and act and highlight unified protocols. We strengthen extreme. Strengthen local leaderships. We need to keep moving forward over state plans on climate health, updated legislation, and adequate financing. Inside SUS for climate actions and health. We defend that health be recognized as a center pillar over climate adaptation and prioritized throughout all mechanisms of international financing. Every real invested over resilient hospitals, epidemiologic resilience, and sanitation saves lives and avoid spending even more money. It includes the climate agenda throughout all our strategic discussions in health, supporting our 27 states over the elaboration of local adaptation plans and contingency, making available to the ministry
our network of strategic intelligence, and through data, we can help preventing climate events, catastrophic climate events. We are able to do everything that we can, so every manager in Brazil has the tools and courage to act. We invite everybody to assume the same compromise, so we use health as a lever in climate changing.
Agradecemos.
We thank you, Tânia Coelho, and we thank once more the presence of Marina Silva presence that unfortunately has to leave do an agenda. Thank you, Minister. Vai, Bruno. now invite to speak the CEO of COP30. Good morning, everyone. It's an honor, Minister, to be invited in name of as the CEO of André Correia do Lago. This path that we've been with the health minister, it's a long partnership, which together we have created the climate plan, which has a cap. Uh, I'm really honorable so I can be part of this path, and now with COP30. And now we have something really important that we should mention, that Brazil is out of the hunger map. Uh, This is an adaptation, and this is health, and this is one of the many ways that we can deal with climate change. Much has been spoken by Marina Silva, which I've worked out for a very long time, that climate change is the biggest enhanced of poverty and inequality. When I started to work with climate change a long time ago, I'm seeing some people that was with me in Saúde Alegria program a long time ago. The biggest image, the biggest picture we had in the climate change was a polar bear. You must remind this that the picture was a polar bear, which we look upon and we saw that if we didn't do anything about the climate change, that polar bear would be in peril. Unfortunately, now when we think about climate changing, the image that came to our mind is about an elderly in a heat wave, really sick, our children malnourished, our floods, and of course another health vectors. Climate change is unfortunately a reality, and thus we should adapt to the climate changing, which what we really wait for COP30, which we have 100 days to do this. We are in a countdown to this COP30, is to bring this urgent mission and in a way that really concrete. Which we really need now is action plans, which are going to be discussed in these 2 days, concrete plans of how, what and how to do. We know that climate change are really many different tragedies, and we know all the vectors, but we wait on COP30 to have solutions and opportunities. We know the problems, but we want to look for the solutions. But we must look to the opportunities too, which health and climate change must go together. It can be in transportation, air pollution, which is obvious, and we can deal with health, respiratory problems, and also in transportation problems, which you can think about transportation problems and active transportation and people health. There are some win-win situations that we must look to it and escalate these opportunities. And there are also opportunities in the area of adaptations and the plans of adaptations that the health ministry are building, which just gone through the public scrutiny, that is about what are the real necessities of these adaptations that we must do to deal with climate change, because dealing with climate changes, we are helping in public budgets. Already thank you guys. Uh, it's to bring the action plan as a health action plan that's been presented, looking to the climate change has already agreed with, and one of the themes that have been already agreed with COP is the paragraph 63 that talks about health, which states clearly that in the global balance, that starting in this, the action plan that we're building in a concrete way to give it some concrete
We'll have now on COP30 things on the negotiation will be really important over health. We are debating the adaptation index on COP30, the famous GGA, and one of the indexes. We see that COP30 is a great opportunity, firstly, to elevate the adaptation theme, which is absolutely fundamental, but above that, elevating the health theme, because we know that if we don't elevate the health thematic, people will not be at the center of COP, and President Lula has already made this very clear. We want people at the center of COP30, and that's why we've created the circles, as Minister Marina has said, the circle of ethnical balance, the circle of finance, and the community circle, where indigenous quilombolas communities will be at the center of this debate over the ex-minister. And seeing Ethel here, we also invited one of our nominees, our 30 people invited in our name, the one sent by us over the health. Is one of the themes is to bring people to the center of COP30 so that we're able to do it in a collective way, because President Lula, André Correia do Lago, all of us from COP30, we know that we'll only be able to make this COP something different if it's this great task force that we see here with the help of everyone, UNFCCC, our great partners. That's why, Minister, I'd like to thank a lot the partnership on on health ministry that from the start, from public Lula government has been working with the environment ministry now on COP30 daily on bringing the health theme on for COP30. So thank you a lot. Be all very welcome in Belém. Thank you very much, Anna. We'll listen now. The President of the National Council on Health, Fernanda Magalhães. Hello, good morning, everyone. I also speak out of the mic for those who have low visibility that I am at the corner of the stage alongside the tribuna. It is an honor for us from Social Control to compose this dispositive. So, in the name of Mariangela Sima and our ministry, Alexandre Padilha, I welcome all of you. But I'd also like to thank Agnes, who sent so many efforts so that this activity could happen. And point that this global conference on climate and health, with the presence of the social control, points the objectives of this activity, which is to work with equity over this theme that's so important nowadays, and think over race, gender, facing social vulnerabilities throughout all territory, so that we may use these days for the preparatory debate for COP30 and get all perspectives on social control, on health, on this mission, which is to be able to mitigate the effects of climate change on health, but also face all emergency and disaster situations, making plans where social control itself is able to be involved, is able to do alongside CONAS its mission, which is the Organization of Public Policy on Health, and on this moment, the relation on climate and health meeting on our territory, so that the actions presented are not only on mitigation, but also on the building of a path on making more inclusion and equity in regards to treatment in facing situations in our country where commerce and productivity on the way it's being done ends up making certain populations even more vulnerable. So may we go alongside on the building of that, and that may this opportunity can give us the way so that specific plans may be within the vigilance of health commissions within the councils. So this action marrying social control plus ministries here and the international action may bear fruit and more life and more quality, especially facing and taking care of our children, our elders, but also thinking of our women who face so much problems throughout their lives, aiming to face all prejudice on the relation of structural racism, so that we may take use of this space to take to our countries this debate that here has an important public but that must reach all social control and throughout all Brazil. Thank you so much. Thank you so much, Fernanda. We'll now listen to the Director of Adaptability Convention on the Board of United Nations over Climate Change, UNFCCC, Josef Nassef. Good morning.
Portuguese you'll hear from me today. I've started lessons, so by the time of COP30 in Belém, we'll be able to converse a bit more fluently. So, in the interest of time, I will present just a small summary of what I was originally going to present. And it's in the form of 4 challenges and 3 opportunities, particularly from the vantage point of the climate change negotiations and having seen the evolution of this work over the past 3 decades. So it's fair to say that we are at a crossroads today, a moment that stands between systems that we've inherited and a very different direction towards the future that we need to build. And as we've heard from other speakers, despite all of the initiatives that were done and the good work that has taken place over the past 3 decades, the gap is still very wide from where we need to be. So first challenge is that health is significantly under-prioritized in the United Nations negotiations on climate change. There is no dedicated agenda item on health like we have on other areas like food, for example. The contribution of finance from the financial mechanism of the Convention to health is very, very small. And something needs to be done to address this. The second challenge is the concept of equity within the health discussion is also underrepresented. So when the UNFCCC talks about health, it's like a one-size-fits-all. There's never a discussion on equity, not just in terms of economic disparities, but also demographic segmentation, how different people, different constituencies, different contexts require a very different approach and are vulnerable in different ways from the health context. Third challenge, the ground level action is significantly missing in the international discourse. So we typically speak about international, regional, national, whereas the front line of vulnerability and of action gets significantly less attention in our discourse. Now, the fourth challenge, which doubles as an opportunity, is a relative lack of awareness of what frontier technologies can bring to the table and what, if not nudged, it can create as we move into the future, including in terms of inequalities, new inequities. But then again, this is the first opportunity I would like to present, because we're entering into an era of exponential technological change, artificial intelligence, big data, Internet of Things, and when governed with care, these technologies can also support resilience by providing real-time systems-level insight into both ecological health and human health. So that's the first opportunity that we need to give much more attention to than we are now. And that brings us to the notion of foresight and the integration of a more forward-looking approach rather than a year-to-year approach in climate policy. And I think there were very wise words that came from Minister Marina Silva, which is the worst thing that we can do is not plan for change. I would add to that that the future does not happen to us, we happen to the future. And if we do not adopt that longer-term orientation, taking full cognizance of the ecological changes, but also the technological changes, then we are likely to be just reacting. And in the context of health, that is not acceptable. Another opportunity we have is the recent elevation of the role of indigenous peoples, the indigenous values, mindsets, worldviews, actions, knowledge, practices. And I think that this added priority that is evolving in the climate change negotiations, where more attention is given to indigenous peoples and local communities, and in their ways of living and their relationship with nature, are good models of integrated living and working systems that respond to the needs of both human and natural systems, including in health. And as we move forward in COP30 and beyond, I think this focus will yield a lot of good directions as the discourse advances. Second, or rather third opportunity, is the global goal on adaptation. This has been mentioned before. For the first time, we have a work stream that measures progress on adaptation based on a future landing zone, not based on the past. And the definition of the future landing zone in the health target of the global goal on adaptation refers to attaining resilience against the negative impacts of climate change on health. Doesn't say just enhancing adaptive capacity or reducing this or slightly improving that. It is an absolute attainment of resilience. And that is where the process is working to develop indicators that enables us to measure at the distance from where we are, between where we are now and where that attainment of the target is. And Belém will be very, very important for adopting these indicators and follow-up actions as we move into the future. This is a game-changing paradigm shift in adaptation that basically trumps anything we've had before in the past 3 decades in terms of the normative thinking on this issue. And finally, the last opportunity is the emergence now of really far-reaching initiatives, for example, the Belém Health Action Plan, and the very firm commitment of the COP30 presidents to elevate adaptation and health, but also to do so while embracing the notion of systemic change and paradigm shifts. And this is, I think, a new thing in the system. So thank you very much, COP30 presidency. I think we will have an excellent negotiating session coming up later this year. And I really look forward to seeing how the notion and the nexus between health and adaptation will enter into a new phase at that point. So yes, we are at a crossroads, not only because of the pressures we face today, but also because of the transformational potential we are building, especially in COP30. Thank you very much.
Thanks, Mr. Youssef.
Obrigado, Sr. Youssef. With the word of Copas, Sir Jarbas Barbosa. Thank you so much, Grafian. Good morning. We're seeing the Minister of State of Brazil, my dear friend Alexandre Padilha. Honor.
The health services from Fiji, Dr. Rato Antônio Rabici Lava Valabu, Honorable Minister of Health and Social Action from Senegal, Ibrahim Assi, diretora executiva da COP30, senhora Ana.
Executor of COP30.
Adaptation from the UNFCCC, Mr. Youssef Nassef. Allow me to use 3 of our 4 official languages from the Pan Health Organization. I'm proud to be with you today at the 2025 Global Conference on Climate and Health. I wish to commend the Honorable President Lula and the government of Brazil for their leadership in prioritizing health, environment, and climate change, and for hosting COP30 later this year. As we convene at this global conference, we do so at a decisive moment on the world stage. We acted to reaffirm the value of multilateralism and intersectoral collaboration to tackle the consequences of climate change in health and its root causes. To put into context the severity of this issue for health and development, I would like to share with you some important highlights from the region of the Americas. 2024 was the warmest year experienced in the region since 1900, with heat waves being the most lethal climate hazard. Also last year, wildfires impacted 70,000 people across Bolivia, Brazil, Canada, and Chile. Floods affected 5 million people in 10 countries, including the catastrophic floods experienced in the south of Brazil. At the same time, droughts affected 1.2 million people, especially in Brazil and Colombia, contributing to food insecurity and malnutrition, as well as interrupted transportation in remote areas. Hurricanes affected more than 4.5 million people in the Caribbean, Central and North America, damaging more than 200 healthcare facilities. Hurricane Beryl was the earliest Atlantic Category 5 storm on record and devastated Grenada and neighboring islands in the Caribbean. Climate-sensitive diseases increased, and the region saw a record high number of dengue cases, reaching 13 million cases, nearly triple 2023's total, with almost 80,000 deaths last year. We must remember that behind these figures are real people, and that populations in situations of vulnerability bear the brunt of these climate impacts, although they are the least responsible for it. In addition, these events had significant implications also for mental health and all other health-related conditions. Under this scenario, we applaud Brazil's initiative in drafting the Belém Health Action Plan, which puts health equity at the center and prioritizes intersectoral action and meaningful social participation. Now I'm going to switch to Spanish. Este plan está bien alinhado con la política de la Organización Panamericana de la Salud.
To strengthen the sector of the health driven by equity over health has been approved last year over the last 35 members of OPAS throughout the 66th Council, the Directing Council. The same has always promoted health resilient systems and guaranteed the access to health throughout all people, reducing at the same time the gas effect, gases, and the plans are in tuition with 2 OPAS initiatives, being one of them the initiative to the elimination of diseases, with the objective is to eliminate in America 30 diseases in conditions related, and on the year of 2030 the plan of giving more attention to non-transmittable diseases. They have at X the guarantee of health access, equity through social landmarkings. With respect to these last ones, OPAS has worked with regulators and water providers to develop water security plans resilient to climate change in 22 countries, benefiting 84,000 people, 7 million only last year. Also has been applied solutions directed by the communities, as well as public and private investments throughout all America, through and other actions, recognizing that other contamination of environmental areas and domestic environments contribute with 24% of death by disease, non-transmittable diseases over Americas this year. OPAS and OMS co-organized the second World Conference over air contamination and health in Cartagena at Colombia. As a result, countries on the region has compromised reducing deaths over air contamination in 50% through to the year of 2040. Lastly, I will conclude my intervention in Portuguese.
Saúde.
We're going to be of health, as well as the official position of Brazil's presidency at COP30, the importance of climate financing, sustainable and accessible one. We are aware that efficient investments, well directed, require solid analysis and concrete plans. The Pan American Organization of Health have been working with its member states and national level and to develop national adaptation plans to health and studies of viability for investments in order to reduce the emissions of the health in the sector, to improve health services infrastructure and the environment of diseases sensible to weather, and implement key changes to anticipate and respond to events related to climate and mitigate its it is running to run the plans, the health plan of Belém through his work with the 35 countries in the civil society and the support of government as Spain and the United Kingdom and other multilateral organizations, the support of philanthropic associations as the Gates Associations in Rockefeller and Wellfund Trust. We'll keep
to keep going and explore innovation solutions for common problems. So we have a great conference when we can reassure the importance of the health as an important sector in the debate about making the world healthier and people healthier. Thank you very much. Thank you, Sir Chavez. Now speaking the Minister Ibrahima Sy of Senegal. Mr. Minister of Climate Change of Brazil, Madam President of COPI, and dear ambassadors, and the participants of World Health Organization, and to the participants of OPAS, so all authorities now present. Thank you, the President of CONAS and the President of Municipalities, President of Health. Good morning, everyone. First of all, I'd like to thank all the authorities and the Brazilian people for the hospitality that we have been experienced since we arrived in Brazilian land. I'm really happy to be here today with you so I can represent the authorities of my country and debate this theme about climate and health. Allow me to thank all the participants, and especially the health minister of Brazil. So he organized and allowing this conference. I would like to congratulate Brazilian team that proposed this Belém plan. So emphasizing governance and the participative governance and climate issues. Ladies and gentlemen, this meeting is really important. We cannot ignore these points of health. Most of all in Africa, each step makes the health system more difficult. The disease are always going up. With the temperature rises and the problems in our community are a lot of famine in these cases, a lot of health, life risks, and a lot of time waste for all the humankind. We have budgets already run out. So we need solidarity and a task force so we can face this weather crisis in the world. The answer to this demand of these world demands and regional demands, Senegal has engaged in working his health system in a strategic way. This means bring the climate issues in the health system. In this, we have a point, the first point, integration in weather, the integration of weather and health in the Senegalese health system. 2, the decrease of 3, the elaboration of National Plan Health. 4, the operationalization of the system in a collaborative system in different systems. And 6, the application of a system Our ambition is clear to reduce the CO level emissions, and this has become a national priority. And this is present in our plans, in the African plans for collaboration. This transformation has been made can only be made with the help of everyone in the world. Thus, we'll look in the local community the help so we can contribute to solve these problems, especially based on the collaboration, learning, knowledge sharing, political engagement, and collabs. So in this conference that we are now gathered here in Brasília, we have many opportunities to enhance our system. The Brazilian system of health, Brazilian health system with sustainable carbon emissions. And finally, I'd like to thank this opportunity to work. I thank you guys for your attention. Good day.
Neste momento,
In this moment, we invite the Minister of Health, Sr. Hatu Antonio Abisi Lalabalavu.
Its colleagues and friends, it is excuse me. It is with great urgency and a profound sense of responsibility that I stand before you today in Brasília for this vital global conference on climate and health. We find ourselves at a crucial intersection. Our planet's health and our collective well-being hang in the balance. I want to take a moment to commend the government of Brazil, the World Health Organization, and all the co-organizers for uniting us during this critical moment for global action. Climate change is no longer a distant threat. It's stark reality that demands our immediate attention, and we cannot afford to turn a blind eye to the catastrophic impacts it has already inflicted. For nations like Fiji and other Pacific Island countries, the consequences are not abstract. They are life-threatening and immediate. Our health systems, already under strain, are facing unprecedented challenges due to severe weather events and environmental degradation. Now is the time to galvanize our efforts and unite in action. Together we can forge solutions that not only combat climate change, but also protect the health of our communities and future generations. Let us seize the opportunity to make our voices heard and inspire decisive progress for our healthier planet. Climate change represents the greatest global health challenge we face in the 21st century. And as a previous COP presidency, Fiji is fully committed to thriving collaborative action on climate to achieve a healthy and sustainable future for all. I speak on behalf of small island nations that lives daily with the realities of climate change. For us, this is not a distant threat. It is lived experience. Rising seas, intensifying cyclones, and shifting disease patterns are already impacting the health and well-being of our people. We must ensure that health systems can continue to deliver essential public health functions during extreme events and under climate stress. This is why the Belém Health Action Plan is so important. It presents a strategic and inclusive roadmap to center health in climate action. It recognizes that climate justice is health justice, and that most vulnerable must be the primary focus of our response. But plans alone are not enough. We need to turn ambition into action. That is where the Alliance for Transformative Action on Climate and Health, ATACH, plays a vital role. In small island nations, we know working collectively is the only way we can solve our biggest challenges. ATACH has become the global platform for cooperation on climate and health. It provides the mechanisms for country-led implementation through sharing of experiences and technical expertise, access to financing opportunities, and tracking collective progresses. Fiji is proud to be a member of the Alliance for Transformative Action on Climate and Health, and we believe it is strong that through this vital alliance that we can ensure initiatives like the Belém Health Action Plan, which are not merely aspirational documents, but true catalysts for meaningful and equitable action on the ground. Our membership in the ATACH underscores the commitment to working collaboratively to build a healthier, more resilient future for all, especially for those vulnerable to the impacts of climate change. Fiji is not merely an observer in the face of global climate challenges. We are an active and dedicated participant in safeguarding the health of our people and our region. We have proactively developed our own health adaptation plan of 2023 to 2030, which is built upon the strong foundation of climate change and health strategic action plan 2026 to 2022. This commitment is deeply embedded within our national strategy, aligning seamlessly with the Ministry of Health and Medical Services strategic plan and reinforced by the Climate Change Act. Our commitment extends to tangible actions. We are integrating climate considerations in the very core of our health workforce, training, ensuring our professionals are equipped to face evolving health threats. We remain committed to this crucial endeavor, striving to extend this vital training to all our healthcare workers across the nation. Fiji has successfully completed over 95% of climate health vulnerability assessment across all our healthcare facilities. The assessment has identified that in 2 large divisions, Central and Western, more than 90% had extreme, unrepaired damage from climate events. The assessment also found that during extreme weather events, between 70 or 80% experienced flooding of roads and bridges, preventing access to healthcare facilities. The critical work informed the application of our climate resilient and environmental sustainable healthcare facilities guidelines, which are currently being implemented in 11 health facilities. These guidelines focus on crucial areas: bolstering infrastructure, enhancing water, sanitation and hygiene, and waste management system, optimizing energy solutions, and strengthening human resources, particularly through targeted capacity building. Furthermore, we are investing in a sophisticated climate-informed disease surveillance system to better anticipate and respond to climate-sensitive health risks. Through these concerted efforts, Fiji is steadfast in its resolve to build a health system that is both resilient and sustainable for future generations to come. In conclusion, our efforts, though challenging, are crucial for the health of our planet and its people. This conference serves as a pivotal opportunity for us to unite in our commitment to both health and climate action. By reinforcing ATACH as a global platform for implementation, we can drive meaningful change. So let us come and work together to ensure that the Belém Health Action Plan not only meets its objectives, but becomes a cornerstone for our discussions at COP30. Together, we can elevate health on the global agenda and create a healthier and more sustainable future for all of us. And thank you.
Thanks, Mr. Hatu. Senhoras e senhores, com a palavra, o Ministro de Estado da Saúde.
Ladies and gentlemen, Health Minister Alexandre Padilha. Good morning, everyone. I would like to salute and explaining to our foreign delegates this is Little Drop, that is the Brazilian mascot of vaccination, a symbol of science, a symbol of life defense. Thank you for your presence, Excellence. Before you leave, you're gonna ask if there's anyone that have not been vaccinated, and you're gonna make a place to vaccinate everyone and guarantee vaccination to everyone. I would like to salute my friends and my colleagues, health ministers in Brahim, Senegal Health Minister Antonio Lalabalavu, Health Minister of Fiji in Salud, all the foreigner and international representatives, especially those that represent United Kingdom, Egypt, Azerbaijan, are which are countries that have been organized COPs before, and which we have created a group, a permanent group. And in the last General Assembly of World Health Organization, we could gather in a meeting like this, which we presented the ideas of the Belém Health Plan Action, which will be built collectively until the COP30 event, which we call, we invite everyone to take part in November 13th, in which we start now this debate in the Belém Action Plan, which has this very important stage, the 5th Conference of Global and Climate Health and Health Climate. I would like to salute my friend, the OPA's chief, Jarbas Barbosa. In his name, salute all institutions connected to the World Health Organization. I would like to thank the words of Tedros, and Jarbas tell Tedros that President Lula and this government says yes to this, to the World Health Organization, and we defend it, and we believe in the multilateral and bilateral mechanisms to face the challenge in our world. Mr. Drop, it's here. Zagotinha, it's here. We are now in a moment here in Brazil that we have facing a really big effort. We are trying to mobilize a big vaccination of sarampo, especially in the elderly people, in the young adults, which we have a good coverage of vaccination in Brazil, and to the children. And after the biggest effort of President Lula and Minister Anísia to enhance the coverage of vaccination and health, we live a challenge that unfortunately denying policies that look to hinder and temper the health systems, and all the efforts that we had in global health coverage. We are living now in the North Hemisphere, big number. Here in the American continent, the OPAs showed us that in July that we had 7,000 cases of sarampo, and the most of it was from the northern part. Most of it motivated by denying vaccination and motivated by the President of the United States that thinks he's the sheriff of the world and thinks that he's president of the world, but he was elected to be the president of the United States. And that this situation makes that down here, South America, we are facing problems with this disease, and we had to donate vaccination components, shot components. That's why Zagotin is here to remember everybody to defend the vaccination. Prevention is always better than medicines. I would like to thank OPAS very much and all the effort and all the collaboration, not only for this event, but to all the mobilization of this region and the cooperation on this life defense. I'd like to salute the director of COP30, Tanya. I'd like to thank all the engagement of André Lago ambassador, and to give attention to the health. I'd like to invite everybody that's here to take part and take part. Belém City is making a big effort to receive and to host everybody. Health Secretary of Belém, it's here with us. Tomorrow I'll leave to Belém and I'll stay there to follow up with the building and the preparations for the to reinforce the local health system, not only to host the COP30, but because everything's already been set off, it's everything ready to host you guys, but to leave a legacy to the city of Belém and to leave a legacy to the state of Pará. The state of Pará government and the municipality of state of Belém work with us to strengthen the health. I would like to salute the three biggest women, the biggest women of health minister. Secretary Mariana, I would like to thank her leadership and her availability. Secondly, I would like to salute our international relationship secretary. And third, Agnes, that takes care of this action plan as her son. And most of all, I would like to sing a happy birthday to you because it's Agnes' birthday. Later on, we're gonna sing a happy birthday to her. I don't know if you know Teresa that sang here earlier. She's a worker in health minister, and we learned that she's a great singer, and she sings samba. And the foreigner representatives should invite her to sing samba, and she'll sing samba later for you guys. I would salute Mario from Fiocruz Foundation, our president, Paulo Gadelha, that was the president of Oswaldo Cruz. I would like to thank this organization, Fiocruz, all the debates and science production and articulation to our unique health system and the cooperation with other institutes and other stakeholders in the world to study the impact of climate change in health in Brazil and in the world. I'd like to tell you about the importance of being hosting this conference, the quality of these debates, and the expectations that this health minister and we all have from this preparation for COP32. We launched, as you know, in the OMS, the ground basis for the action plan of Belém, but that's just the first document for our foundation. Our expectations that these 2 days is the systematization of the next 103 days until the COP32. We can mobilize and we can aggregate more countries signing this document. As Minister Marina said, my friend and government colleague, I would like to thank her and explain that she had to leave. We didn't leave our urgency state. We live in an emergency state.
It's a necessity of transformation. The one talking here is not the health minister of Brazil, of the importance of transformation. Who's speaking here is the doctor, infectologist, Martania, our president from CANAS, the regional governments on health, that see each day the impacts of our climate change on the health area. Me, as an infectologist on the 90s, on USP, on São Paulo, those who are from outside, is the biggest hospital on Latin America, and São Paulo is the biggest city in Brazil. We didn't have Aedes aegypti, the dengue transmitter, on São Paulo in the 90s. There was no dengue being transmitted locally in São Paulo on the 90s. We looked throughout all districts, all neighborhoods, through periphery, every place that had difficulty in providing water. We couldn't find Aedes aegypti on the city of São Paulo. And since the beginning of the 80s, the state of São Paulo has always been one of the greatest dengue numbers in Brazil, either near coast or within the country. We would go down, we couldn't find dengue on our shore. We could walk inside São Paulo through Campinas, and you'd find dengue. You couldn't find it on the city of São Paulo. One of the explanations on that moment is that the city of São Paulo, even though it had a tropical weather, with medium temperatures. We had a very cold night, and throughout the night, the cooling during the night would stop the multiplication of the mosquito, and therefore we couldn't have its transmitter, its vector. I was already secretary in São Paulo on the government of Fernando Haddad, and we lived in 2015 one of the main epidemics of dengue in São Paulo. It went 27 years. It was all it took for the mosquito to adapt. It adapts really fast to human habit, but to augment the medium temperature on the night, which allows dengue to be a reality on São Paulo. And the state of São Paulo this year was responsible for over 70% of the dengue case occurrences in the country. Over 80% of dengue deaths have been occurred through São Paulo, over the states for São Paulo and Minas Gerais. The one talking here is a doctor, infectologist that went through the Amazon region when I was done with my formation on the end of the 90s to live there for over 6 years at Tapajós. I see Caravano from the project Health and Joy by the Tapajós on Rio Amazonas River, from the indigenous community of the people Zoam, the community of people YY. We've lived together on Tapajós, and knowing what's changed on the life of these people when they send in the images of the big dryouts throughout the Amazon region through the last 2 years, that has impacted strongly over people's health. The one talking here is the father of a 10-year-old girl that for a very long time, for all of us, the idea of facing global change was preparing the planet, protecting the planet for next generations. But my daughter teaches me every day, because she already feels the impacts of climate change on her daily life, on school, and every day she says, "Dad, I can't understand how there are people that do not comprehend that we live on the same planet and that health must be unique, humane, animal, and environmental." Every time she's picking me over climate change. So we have a moment not only of urgency, but of necessity of mobilization for transformation, as it's been stated by Anna Tony, as it's been said by Ambassador Lago. We need to do a real task force, which is a word incorporated on the Brazilian tongue, not only by indigenous people, but rapidly taken by other people, that makes transformation that one person alone cannot do. That's why mobilization of all society, of all countries, is fundamental and decisive to coordinate and lead this task force. Brazilian government, I feel the Brazilian society in moments like this, as he was here, the national representatives of health that represent society, they had contributions on social. Brazil has been aiming to participate on this task force with desires, with plans, because we also move in regards to desires and plans, but with compromise and policies that we've been developing. Being able to show the world the advances of these policies, the obstacles we have to implement these policies, the steps backs we've been having on these policies, but concrete cases, so that this concrete experience of a country as big as ours, with all its inequalities, with all its responsibilities to the world, being one of the countries with a greater portion of tropical forests in the world, we need to show it to the world. The concrete experience of building a adaptation plan to the health system, built nationally, coordinated by the Ministry of Environment. It had a great contribution, a concrete experience facing viruses, dengue, with over 70% of causes in Brazil, reduction of over 80% of deaths compared to the last year. The concrete experience of mobilizing together populations that take care of our forests, that are real barriers in regards to global climate change in Brazil, and how to adapt the health systems, how to reach these populations, how to reorganize our national systems of health to be able to handle the specifics of these populations. The concrete experience, and very painful, as it's been said by our dear Jaber Barbosa, of having to face at the south of our country one of the most denier region we have in regards to global climate change. We had to face the biggest flood of the century in that region, and in health system we had to build and rebuild over 100 units of hospitals that were completely wrecked. We had to invest on rebuilding and adapting many dozens of hospitals and hospital services that had been dismantled. We need to act strongly, mobilizing the whole country. I wish to thank CONAS, Dani, the organization of the secretaries of all regions in the country that were solidary to our brothers and the Brazil South at that moment of people mobilization and insumes, medications, vaccines, the effort of mental health, of taking care on regards to mental problems that came in regards to the disaster motivated by climate change, showing challenges that we are living in practice. So our collaboration is not only of desire, of plan, of study coming from our researchers, from our institutions. We are very proud of having them, but it's also a practical experience with all its mistakes, with all its rights we've had in a country of our size. That's why we are rooting, working the whole time, as it said, being said by Minister Marina, that this copy face the reasons, but that the health issue will be of the person that will show the fever to the health team until it realizes that just tending to the symptom is not enough. That will throughout the whole time show the pain of a tumor that is inside the person's body that needs to be taken out and treated, otherwise we will not be solved. All the time we'll be showing the robot, the heat, the inflammation, so that the action is faster and more effective in facing the reduction of the emission of carbon monoxide in the world and in our country, but at the same time present and build in the Belém plan a concrete proposal of adaptation of the national health system to face climate change. And this is not something of the future, it's something of the present. It already affects the health of our population, it already affects the unique health of our system. So we need to move, we need to act and keep fighting so that the causes of climate change are effectively attacked throughout world leaderships, not private and public sector, in action that work with all its dimensions, from preparation of the health systems, our capacity of obtaining data, utilize all intelligence as we can, as said Secretary Tanya, to predict and organize and plan the health systems, as does the city of Rio de Janeiro today, having built the effort of a municipal secretary in a partnership with OPA, the health ministry, a great center of health operations in Rio that has sensibility to identify how much has a little bit of difference in heat has put up the number of people with dehydration in healthcare and numbers of heart attacks, the worsening cases of respiratory issues. On that day, how has the prediction of what may happen throughout the next weeks, throughout the next months, possibilitate an even greater planning? On its building method, our experience on the tragedy on Rio Grande do Sul showed how much we must rethink the building methods of the health systems, of health equipments, of health units, where they must be built, what's the location, what's the material, what are the equipments, what its capacity to resist situations like this, to think includingly new technologies that will adapt to new realities, technologies that will reach to rivers that will flood on Amazon, that can reach, in fact, to most remote regions of the Pantanal, to regions, most remote regions in our sertões. We need to organize the services to us, the building blocks up to COP30. Brazil will take this moment to review its politics, review critically its politics, but also to build new ones, meaning our colleagues from Amazon. Legal Amazon, I see them here. We wish up to COP30 to consolidate a new health plan for a legal Amazon in Brazil. More health Amazon, My Saúde Amazônia built, reviewing everything we've done of positive over the first, second governments of President Lula. I've been a part of that on Dilma, and the effort has been done since the beginning of this third government of Lula president, but it's been done alongside civil society, along local experiences and scientific production, academic production, with daily exercise of what we learned and what we've made the effort to build as a public system in our country to the Amazon reality as to other biomas, because we only defend our great biomas if we're able to give biomes to those, if we are able to give life quality to those who live in it, to those who build families, to those to build a identity around these biomes, to those who live permanently in that reality. We need and must have the support of those who don't live in those biomes to sustain it. The serial financing, even from Brazil, to sustain policies of the maintenance of these biomes, but it will only survive if those who live in those biomes have quality life, have knowledge, have access to technology and economic alternatives who are sustainable on that region. So with that spirit, Brazil intends to get to COP30. I wish to thank immensely to all who are involved here on these 2 days of intense discussion. May it be very productive in regards that we can build a plan to be presented and signed by many countries in Belém, so that they are a milestone on the construction of COP30. And I was also very happy with the speech, not only with Ana Detoni, but with the representative from ONU in regards to the possibility of advancement on regards to health in the negotiations of COP30. I wish to end saying, thanking each and every one of you, and invite strongly all of you to be alongside us. We are absolutely convicted that mitigating is essential, but adapting the health plans to the climate change and to the urgent and emergent. And it's with this dialogue, with this heart, that we believe we'll be able to build a consistent plan to be signed by all delegations that come. Thank you very much to all of you. I'd like to thank a special hug, Caetano. You who are filming there, send in a hug to Rede Mocoronga of Communication.
Thank you very much, Minister. We invite you and all the other authorities would stand behind in front of the stage for the official photo of the event.
Está encerrada.
It's finished the opening season of the opening session of the Global Conference on Climate Health. We will have a brief intermission of 5 minutes. We ask you guys to stay here in the auditorium. We thank the presence of everyone, and we'd like to thank you guys the presence of our honorable device. May we all have a nice day.
Senhoras e senhores, solicitamos gentilmente para que ocupem os seus lugares, para que
Move to your places so that you may accommodate, because we'll be following with our conference. Thank you very much.
aos demais
To other participants who encounter themselves outside of the auditorium, I hope my voice reaches out to you so that you come to the auditorium. We'll be following with the conference.
Vamos compor a mesa, tá?
E eles vão arrumando enquanto isso.
A doutora Maria Ângela pediu, vamos compor a mesa.
Tudo bem. Se eu tivesse pelo menos uma previsão de quanto tempo mais. Dando continuidade.
Following up with the beginning of the section 1, the action plan of health from Belém, we are inviting to the panel of honor, Hatu Aton are invited to the table, to the head table. This section will be moderated by Helena Villalobos from World Health Organization. Please, Helena, make yourself comfortable. To open the section, we invite Mariana Angela Silva, Secretary of Health Ministry of Brazil. And then invite Dr. Mariangela to present the plan. Well, good morning to everyone again. I'll begin where the minister finished. He said in his last words that mitigate is essential, but to adapt the health system to the climate emergencies are urgent. So I think this is the main point that is behind this plan organization. I must say that this presentation will be presented now in English, but would be available to all the present in English and Portuguese in the end of this conference. And I must say that I will speak in Portuguese, but the presentation is in English. So we start the presentation, remembering, if you allow me, most of you know, what is a conference of parts? This kind of conference we deal with the weather panel that Marina referred in 1992 in Rio de Janeiro conference. There are other parts conference, so there's not the unique one, but the most famous of us is the tobacco one. The tobacco control as an epidemic, and is the oldest. So I must tell you too that Brazil actually, in this whole process, this is just a general overall picture. We are talking about 6 axes that the COP30 has. 1, 2, 3, 4. You can see that the axle 5, that is regard to the social stimulus, human social stimulus, that's the most connected with health, but not only health, but health it's connected to all the areas, especially the last axis that is transversal, that includes many facilitators, so the others can be created. So how we insert the health action plan of Belém? The plan comes as an answer for weather urgent. It's undeniable today. It's undeniable today that we had an urgent weather issue that affects the health of people. And Brazil brings this plan in this moment as the the main stage, because the health has answers. The health plan is a person we can use it. There's something that we can the agenda, the weather agenda, it's bigger than the health, but we can use the health to do this. So this action plan has been told by Minister and by Anatolia. Actually, Brazil is proposing a calling task force. We are trying to look for a word in English that bears the meaning. What is a mutirão? I can't think in a word for mutirão. Collect effort is much more than this. It's a collective effort of many people, of many sectors of the society. And what we are looking for with this action plan, it's an volunteer adoption of the member states of the weather panel, and it's supported also by the civil society and people that are not from the government. So the plan actually it has two cross-cutting issues, two big priorities that already been mentioned. The first one is health equity and climate justice, and I have been telling you I've been saying about this theme for a long time. I think that the climate justice is something new for health, but it has everything to deal with health. So equity is something that we know, and we talked about COVID crisis, talking about the access to the goods and services regarding health. So that's a term that we already know, equity and inequity, but climate justice is something new that we should come close really fast in health to understand and to adapt in health agenda. And the second big priority is leadership and governance on climate and health with social participation. You have heard the people, especially you guys, the foreign people, we heard about the social control in Brazil. Yeah, we have difficulty translating this. This is not the government controlling the society when you're talking about this. We're talking about how people participate, taking decision, and the health system in Brazil has this really deeply rooted. We had Fernanda saying this, the president of the council. See, the commitment of Brazil with the Belém plan, and I'm calling who's not Brasilia, and I'm making calling is not Belém, it's not Belém, it's Belém. This is just for who's not Brazilian. So the Belém plan, we're reinforcing the multilateralism, as the Minister Marina said, and also said by Anatoly. But this is the commitment, an unshakable commitment that Brazil has with the participation and the sovereignty of the territory and other attempts of foreign countries to temper the decisions of the Brazilian people. This plan that we are presenting to you guys, the Belém Action Plan, there are 3 action lines. I will show you guys each one of them, but I won't read each one because it takes 1 hour and we are really late. So with this timetable we have. So with these action lines, we have propositions, measures to resilient health systems for adaptation and development, resilient health systems. The first one is the surveillance and monitoring, and the section line is evidence-based policy strategy and strengthen of power, and action line 3 is innovation and production. And take us to the action line 1, surveillance and monitoring. We have three sublines. First is to improve health surveillance and based in early warning systems climate related. To develop or improve climate informed health surveillance and early warning system. That's the first sub-action of the first action. That's a language that we in health system we know when we're talking about priorities. This is what's something that we know. Identify a priority list of climate-related risks and disease and develop strain. And the third line of action regarding the surveillance monitoring is strengthen preparations and strategy. Actually, I'm making a free translation. It's to keep a stock of other products like vaccines and other products as a preparation. So this is the three sublines of action of surveillance and monitoring. So now in action line 2, we have 8, so I'll go a little bit faster. So evidence-based policy strategy and capacity building. So why we're insisting so much on this on evidence-based policy? The minister said about it with a lot of probity and passion. We are living in a world that is a little, it's always denier about science, and we are facing challenges. The minister mentioned measles, and this is a concrete case that we are having here in South America and in Brazil. And Brazil had a certificate of measles eradication, but because of this, other countries in America's imported cases of measles in Brazil. So we are one by one. We are trying to make a blockage and to check and taking all measurements to avoid measles to come back to Brazil. But the world that we're living, it's a really changed world, connected world. That's important that we have the importance of evidence-based policy strategy in this world. So here we have this. The first one is the climate. It's adapt of standardized terminology. And the second one is the have a smart workforce to manage climate changes and challenges that are appearing because of health emergency and weather emergencies. Promote community resilience and make a better perception of health. And also, we cannot take it out, including these policies, the gender issues. And still in the action line 2, we have some strategies health strategy to promote. Strategy to public policies to benefit health. So what we're talking, which is the agenda, the weather agenda, it's unrelatable of health. We need to relate them. That's what we're living. That's as the minister said. I didn't hope to live.
What we are able to do. Half of the working force are the last two of the second line, integrate health, mental health, and psychosocial policies on adapting the health system over climate change, and also people with disabilities. On the third line, let me go through it rapidly. Innovation in production, and of course, it's an area we have lived with the difficulties we've lived through COVID pandemic. Firstly, because we must have a service infrastructure that's resilient, that can handle it. Secondly, we must develop health programs that are able to take in account the climate issue. Third, we must evaluate what these politics in regards to adaptation and resilience and health and climate they can actually bring in the matter of improvement. It's a question that the health system do very well. We may not know that doing the adaptation to just transitions, I think there lives a big challenge. And I guess this is the last, which is the logistics supply chain of goods on the science in the health field, which is a cost in the case of Brazil that has by obligation to provide, for example, medications, vaccines, and diagnosis to all population. The prices of these technologies must be just so that the country is able to maintain an inclusive policy. So let's go. I know I'm doing extra time, but let's move on. So getting towards COP, I'm going to get attention to this image from COP. Does anyone who here knows who Curupira is? Curupira, if you check, it has its foot backwards, and he's one of the mythological creatures in Brazil who protects the forests. And this is the symbol of COP in Brazil, of COP 30, is Curupira. So, on this conducting to COP 30, what we've talked on the Ministry of Health has been done a series of consultings. We've been endorsements. We've been developing meaningful matters in strategic implementation and also generating demand as up to getting to COP 30, having stated our ground strengthly over COP, and this will happen. This is happening. What we are doing here throughout these 3 days, what we call participatory consultations. We are looking forward to doing a more inclusive process. In March, we had a preliminary consultation over the action plan on climate and health action. In May, we've done an parallel event on the first day of the World Health Assembly, where the Belém Plan was presented alongside the countries who make the Baku coalition. There is the United Kingdom, Egypt, who are here, Azerbaijan, Arabic Emirates, and Brazil. Did I forget any? Agnes, I was about to tell the secret that it was your birthday, but I think the minister talking about it. I feel like there's probably more people who deserve a happy birthday today. Only 2 people were born on the 29th. This is very weird. There are people who are hiding. Anyway, in the next step, after July, we'll have a parallel event on the General Assembly on the United Nations in September, and we'll end with us getting to COP 30, saying that between September and November we have plans to do consultations with the signatory countries to be able to have more support to the health plan. We understand that the health plan is the most concrete thing we may have in this and in other COPs. So throughout this preparation, what are we gonna have? We will launch through COP a supporting document synthesizing evidence over climate and public health policies who are available, and will present also a synthesis report on social participation in climate and health adaptation. So these are the 2 products we'll be taking to COP 30 and the Belém health plan that the minister has already coded. You know that in November we have the Health Day, and the Ministry of the Environment and Foreign Affairs in Brazil, who are leading COP30, established many envoyees representing the sectors. We have at least one of them here. There's the Dr. Thelma Cialum, which is a special envoyee. And I'd like to say that we intend to get to COP30, and propose that on the 31st, 32nd, that this may happen, that the health sector, the plan on health in Belém can be evaluated preliminarily on COP31, and that we may institute that each COP have its health issue theme. There's a rising perception that health may contribute plenty, not only of what we can, but because we need it. So let me end stating the following. I've been saying because we have been having many movements in Brazil, many events, product copy, over health, but in 2 weeks we'll have the 5th National Conference in Workers' Health. And when we have these big events, I'm always thinking of one thing, which is a saying that I've been told from the Caribbean region, from a friend from Bahamas, that says, when everything's been said and done, may we have more dones than saids. And let's get to COP30. Thank you.
Thank you, Secretary. At this moment, we start the small talks about the action plan of Belém, gathering representatives of governments, social societies, and indigenous leaderships and communities. We ask for the head table, Hussein Aranji, the Secretary of
the United Emirates. Hossam Abji El Ghafa, Assistant Minister for Institutional Reform in Egypt. Ellen Yaxley, Climate Change Leader in the United Kingdom. Bugar Mamadavi, Boss of International Cooperation in Azerbaijan. Amban Pillai, Vice Director of National Department in Health in the Presidents of G20 in South Africa. Youssef Nazef, Adaptation Director, Convention 4 over the United Nations on Climate Change, UNFCCC. Daphne von Buxhoeveden, Unit Boss, European Commission. And Danilo Moura, Specialist in Climate and Environment by UNICEF. With the word, our moderator, Elena Brax. Thank you.
Unfortunately, Maria, our director, Maria Neira, Director of Environment, Climate and Health in WHO, was not able to come for different reasons. She's retiring in 1 week. And basically, I had the exciting role to play to moderate this session. I think it's going to be very difficult for me first because I need to replace Maria, which we all know is quite difficult, but also because in theory I have to moderate 18 people speaking in 2 hours. So
Then I think I will be very strict with time.
A reminder to everybody, and maybe I just make a few remarks from the WHO side. I think the initial session was quite touching. I think I got too many words that I think will resonate with us over these days. The first one is probably celebration. I think we have to celebrate this muchirao and this opportunity that we are all having to contribute to an action agenda that Brazil is leading. We also have to celebrate Agnes' birthday and all the efforts that our Brazilian colleagues have made. You cannot imagine how much work they've put into designing this conference. So thanks to all of them, and of course to our colleagues in PAHO for the amazing work that they've been doing. We also have to celebrate the amazing partnerships and key actors that are becoming stronger in supporting this agenda. And we have the Wellcome Trust, we have Rockefeller, we have the Gates Foundation, we have Spain, we have the UK. And it's really amazing to see all these efforts coming together. So again, muchirao. I think it's important for us to retain also that the last thing that we can see, the best that we can get is action. And I think we also have to celebrate and to thank the leadership of all the countries that are basically leading this space based on their own context, based on their own knowledge, the agenda, and the opportunity that we have to learn from there about everything that is happening. So I would like to thank the Minister of Health from Fiji for basically arriving this morning to be here with us and to share with us not only the survival issues that they are facing, but also the solutions that they are implementing to deal with this. And thanks also for the representatives from the Continuity Coalition. So I didn't tell you, but today is a historic moment because this is the first time that an official pre-COP event is focusing just on health. So again, I think it's another moment to feel part of this historic moment and to celebrate the previous historic moments that colleagues sitting in this panel will be sharing with you. I think the last remark probably from my side is that this muchirao is a little bit like the ATACH. So basically what we are trying to do with this Alliance for Transformative Action on Climate and Health is to put together all of the partners, all of the actors, basically trying to do more on climate change and health, again, action, but basically serving the countries. For us, the most important is to know what countries need, to know what their priorities are, and basically to design and to try to tackle those. So with this, I think that's it. I will start inviting all the excellent panelists that we have. And the first one will be His Excellency Ratu Antonio Ravici Lalalabalu. Please take the floor.
Thank you, and Excellencies, colleagues, Buluvinaka once again, and thank you for this opportunity to speak on behalf of the Western Pacific region. And I bring with me the warm greetings from your brothers and sisters from the vast ocean of the Pacific Islands. Today, I just want to emphasize the urgent need to why we should adopt the Belém Health Action Plan for the adaptation of the health sector to climate change, particularly focusing on the unique challenges faced in the Western Asia and the Pacific. As climate changes escalate, the responsibility to protect our most vulnerable will fall squarely on our health systems and how it is prepared. And therefore, the Belém Health Action Plan is not just timely, it's a pivotal framework that must align seamlessly with efforts like the WHO Global Action Plan and the COP28 Declaration. But for it to genuinely be effective, it must clearly define how it complements these existing frameworks. and avoid any overlap that could dilute its impact. And we call for a consultation and implementation process that is inclusive and transparent. It is vital that member states in the Western Asia and the Pacific have clear pathways to contribute to the plan's development, including the terminology and classifications, and that they can adapt to it to suit their specific context. And context is very, very important. This implementation must confront both international and domestic inequities with a defined set of roles for WHO, UNFCCC, and regional stakeholders. Cross-sectoral collaboration, as I've seen in the presentation, is also non-negotiable. We must embed health considerations into all policies, ranging from urban planning to agriculture, especially in climate-sensitive regions. In the Pacific, where health directly intersects with environmental conditions, and in Western Asia, where issues like water scarcity and extreme heats, intersectoral coordination is essential. However, it's crucial that we clearly establish the link between reducing carbon and building resilience against extreme climate events. This connection is not yet well defined. The plan commitment to equity is commendable, but let's go further. We must ensure that gender-responsive policies are standard, uphold the rights of sexual and reproductive health, and include indigenous peoples and marginalized communities. The rights of persons with disabilities must also be front and center in ensuring everyone can access vital information and care. Particularly in the Pacific, traditional knowledge systems are invaluable for climate adaptation. In Western Pacific area, we cannot ignore the disproportionate risk faced by the migrant and low-income laborers. We must invest interoperable early warning systems across regions and sectors. The Pacific is already integrating meteorological data with health surveillance, and Western Asia should adopt similar innovations to monitor heat-related illnesses and waterborne diseases effectively. Prioritizing vector-borne and neglected tropical disease is essential, especially in tropical Pacific nations across shifting climate zones in Western Asia. Innovation and infrastructure are paramount. We are already seeing success with digital health solutions, sustainable procurement, and low-carbon infrastructure retrofitting. And let's harness these efforts to strengthen resilience in the Pacific Islands and the Western Asia, especially for remote and underdeserved populations. Finally, we must ensure that the Belém Plan is integrated into national determined contributions and National Health Adaptation Plans, HNAPs. Regional cooperation for sub-regional planning and resource mobilization is crucial to ensure that no country is left behind. So let's move forward together, driven by the principle of climate justice and health equity, and the time to act is now. And once again, thank you for the opportunity. Naka.
Thanks a lot, Minister. Just something about Fiji is not only that they are leaders politically, but they also with WHO. We were developing a guidance on climate resilient and environmentally sustainable healthcare facilities because it was a priority for Fiji, and you were faster than us. So basically, they did the first ever national framework on the topic, and basically they help us to develop the approach that we are implementing now across the globe. With this, I will invite the second speaker, and I think we will move directly with the representatives from the different COP presidencies. So I will invite first Dr. Hussain Al-Ran, who is the Assistant and the Secretary Public Health from the UA, and maybe he can share some of the historic moments that they led at COP28.
Your Excellencies, colleagues, ladies and gentlemen, greeting from United Arab Emirates first. Let me begin by expressing our deep appreciation to the Ministry of Health of Brazil and WHO, as well as PAHO, for organizing this timely and important meeting. The UAE welcomes the Belém Health Action Plan and commend the collaboration effort leading to its development. I hope it will further integrate our climate change and health action. I am sure that the Belém Health Action Plan will harmonize and synergize existing climate and health-related initiatives and build on commitment from previous COPs. The COP28 UAE Climate and Health Declaration is a milestone that was awaited for long, and the Belém Health Action Plan will be a roadmap to strengthen climate-resilient health system, especially as we move toward COP30. The UAE, like many countries in the Eastern Mediterranean region, is witnessing accelerated climate shift, raising temperature, prolonged waves, increased humidity, sea level rise, and pattern, all of which have tangible and growing health consensus, ranging from heat-related illness and respiratory and cardiovascular condition to a growing burden of vector and waterborne diseases and mental health impact. To address these challenges, UAE is finalizing an updated National Health Adaptation Plan set for launch by the end of this year. We are aligning this plan closely with the action lines of the Belém Action Plan, particularly in surveillance, policy, and innovation. At the same time, we are investing in the climate-smart health infrastructure and on building a climate-smart health workforce by scaling up training and on climate-related health risk, particularly for primary care providers and emergency responses. We also strongly support the climate justice and equity principle embedded in the Belém Action Plan. We must ensure that the adaptation effort prioritize the most vulnerable, those who contribute least to the crisis but suffer the most. As a country commitment to the regional solidarity, we emphasize the importance of implementing the common but differentiated responsibility principle to advance equity and environmental justice, ensuring no one left behind to face the acceleration risks. Your Excellency, UAE is proud to be part of the PAHO COP Presidency Continuity Coalition for the Climate and Health and founding member of the ATACH Advisory Board. We believe this coalition, ATACH, and partner must now move from planning to a coordinated implementation. We therefore call for creation of a technical and financial implementation mechanism under the plan. Some countries in our region need technical assistance and capacity building. Others need financial access and to climate funds. A structured mechanism must address these both. We also highlight the need to invest in climate-smart health infrastructure, expand telehealth, and promote digital innovation and workforce training. These investments are essential for long-term resilience and equity. Finally, allow me to thank the government of Brazil once again for its warm hospitality. The UAE is committed to bring among the first implementer of the Belém Plan, and we are ready to cooperate in advancing its vision for inclusive, evidence-based, and injectable climate and health action. Thank you very much.
Thank you very much, Dr. Alran, for reaffirming the priorities included in the Belém Health Action Plan and calling for more capacity building and finance to ensure implementation. Allow me to invite now Dr. Hossan Abdel Ghaffar, who is the Minister Assistant for Institutional Reform at the Ministry of Health in Egypt.
Distinguished delegates, partners, and friends, it's an honor to speak on the behalf of the Ministry of Health and Population in Egypt at this vital session at this time in this conference. On climate change and health, we extend our deep appreciation to the government of Brazil and the Ministry of Health, World Health Organization, and all the partners which are helping all the countries, and especially the country of Egypt, in adopting the climate and health agenda. 10 years ago, our main problem was to convince the decision makers and the public that the climate change is hazardous to the human being. Nowadays, it's not the problem anymore. The problem is trying to convince the governments, the decision makers, and the public what we should do about that. The main issue is the climate change is moving much more faster than our actions. So we need like 10 years to convince the decision maker and the public about the hazardous effect of the climate change while it moves dramatically much more faster. Now we need to take an action because it's becoming it's good to take an action about climate change and health and everything. It's a must. And the problem is we can classify countries and people according to a lot of things. None of them is related to the effect of climate change. You can classify people according to financial situation, burden of disease, and how much the country is developed. We have a first world countries, second world, third world, but you don't have a country or a human being not affected by the climate change. And the second problem is the climate change is not a unisectorial problem. It's not only affecting health. It needs health participation, it needs energy participation, transportation, food and agriculture. Every single entity needs to participate in our action plan to take an action against climate change. Capacity building is a must, financial is a must, but I think the sole single must, what we should do is a total synchronization between all our efforts. A total single synchronization between the globe. It's not enough that the Ministry of Health in Egypt is taking an action. It's not enough that we in Egypt realize that and we have now the National Council for Climate Change, which helps all the stakeholders in Egypt related to the climate change. Ministry of Environment, Ministry of Health, Ministry of Agriculture, all the ministries. It's not enough. It's not enough that we are taking a tremendous shift towards reducing the CO2 exhaustion from our pharmaceutical industries, from our hospitals. Even we are doing reduce the patient journey because our study showed that more than 45% of CO2 exhaustion in the healthcare facilities comes from the patient journey. So we need to start reducing our patient journey. This is not enough. What we really need to do is to call for an action altogether. And what I hope, that's what we are going to do in the Belém Action Plan in COP30 in Brazil. And we are all committed to that. And I here to announce that the government of Egypt and the Ministry of Health is totally adopting the Belém Action Plan for Climate and Health. So that's what we all need to do, to have a total synchronization. WHO, FAO, ATACH, I can, we can, and we will never can unless we have this global synchronization of our action against the climate change. And I thank you.
Thank you very much, Dr. Abdel Ghaffar. Thanks for this passion and this commitment to action. I think Brazil is getting excited because we have many countries already reaffirming their voluntary commitments to do more and to implement the Belém Health Action Plan. So let's keep this synchronization of efforts at global level also as one of the key messages that we will be coming back today. Let me please invite His Excellency Minister of Health from Senegal, Dr. Ibrahim Assi, to please take the floor and share with us some reflections on the Belém Health Action Plan.
Merci beaucoup.
Thank you very much. Forgive me for I was at a meeting with the Brazilian ministry. Allow me first of all to thank the doctors from the health ministry for entrusting us these issues on Africa. We'll talk now over some aspects on COP30 in Belém, and we'll share a little bit of the points and what we'd like to highlight. The first point is that this action plan is written on Arari's declaration, adopted in 31st of October in 2024, which is a consensus amongst the ministers and the authorities from the private sector and international representatives from 54 nations and from some big independent states in Africa. This declaration is a vision, a common vision of all these participants over climate change in Africa. The action plan project of Belém will be primarily constituted of a path that takes into consideration health issues and is able to relate it to the impacts of climate change and the integration of intelligent mechanisms, promoting this way a sustainable development and equity and justice. Another focal point is that Belém offers a global stage and meets what we hope for in Africa. And in this sense, that Senegal desires to highlight the terminology utilized on Belém's plan on the matter of cultural sensitivity. And thus, these two documents can offer a solid base of a equitable health system putting health at the heart of climate issues. In regards to Africa, we reinforce the need of adapting the financing mechanisms who are a real struggle today in health matters, because we don't have many projects in this direction in Africa. Only 2 to 3 countries, and it's very little in face of the climate challenge imposed on us. In this way, we emphasize the matter of equity and intersectional partnership in Africa, so that we may have the production of knowledge and the due adaptation in an efficient way, generating an engagement who is strong and good in health levels. I appreciate the attention.
The Minister, he is now a global champion on climate change and health, but I just wanted to highlight that he has been a champion for many years before, and we had the privilege to collaborate with him, to learn from him, and basically it's amazing that he's bringing this leadership, this science background that he has into the political space now. I think it's important, this request that he made, to basically have the Belém Health Action Plan included in the regional climate change and health processes and the declaration, the Harare Declaration that was signed in 2024. So again, congratulations Brazil, because I see a lot of movement in moving to action and really integrating this agenda into national commitments and regional commitments. With this, I would like to invite Helen Jaxley, who is the lead climate change and health in FCDO in the UK. Please, Helen.
Good afternoon, everyone, and thank you to the Government of Brazil for hosting us and convening us. And we admire your leadership and your determination, really, to put health way more centrally in the climate agenda. So thank you for having us. And it really is a privilege and exciting to be here to reflect a bit on UK experience and the plan. So when we started with the COP26 health programme only a few years ago, we were full of optimism, but I think a bit of trepidation at the time as well. I'm not sure we ever quite imagined we would be where we are today. So that's just brilliant. It's heartening to see that we've come together, committed jointly to address these complex and inextricably linked global health and climate change challenges. We need to really keep this momentum going, and this is what this is about, really. We also know that the health challenges posed by climate change are shared, but we also know that developing countries and those living in poverty are those that are most exposed to the worst consequences of the climate emergency. So we really must move faster, harness the opportunities and solutions that we have, and work together to realise a mission of a world free of poverty on a livable planet. The Belém Action Plan for Health really does stand to help us achieve that mission, and in doing so, protecting lives, health and health systems in the face of climate change. But we're also not starting from scratch. Whilst we need to innovate, there's lots to build on already in the climate action world and in our health approaches, at global level, regional level, country level, and within communities. We have strong frameworks in the COP28 declaration, the WHO resolution, and the Global Plan of Action. And there are all a range of mechanisms, such as the ATACH that we've heard about, but also that other people have launched at national and global level. We hope the plan will build on these and harness them, but also have a clear offer to make, one that helps us embed climate in routine policy and programming for health and public health initiatives, one that also ensures country ownership and that helps us to forge the partnerships and collaboration necessary to achieve this agenda. We really welcome the importance placed on equity and participatory governance. Addressing the needs and learning from different vulnerable groups is key to this agenda. We support all of the highlighted areas in the draft plan as crucial actions that we all need to take to drive health sector adaptation. Indeed, in the UK, we have been trying to work towards this. For example, our NHS has now got a publicly available climate change risk tool, which helps our facilities to assess the vulnerabilities they are facing. It helps us to identify actions we can take at that level and also improve the infrastructure of our health services. On heat, now this is something Brits were not very good at. We don't cope with it very well, and hoping to learn from others on how to do so. But we have evolved our very strong collaboration between our Met Office and our health authorities on cold weather systems to now include effective systems for heat health warnings and actionable alerts for the public. However, we're still working to better understand the best channels for disseminating information, who it's reaching, what are they doing with that information, how are they responding. We're also very aware of alert fatigue, which it comes with the risk of focusing too much on emergencies. So we need to combine that with strategic prevention alongside our emergency response. As it expands, we really hope that the plan will be able to emphasize these multi-sector, multi-agency collaborations required to deliver most of the areas that I've highlighted in the plan, and building interoperable and integrated systems, and also have research that's more focused on the what we need to do rather than making the case. We've won that argument. That's why we're here today. A successful plan, I think, also needs to be monitorable. We need to know and understand the progress we are making and what works. But we have big global frameworks like the Global Goal for Adaptation, the Global Action Plan that the WHO prepared and was adopted this year. So we need to align with that, but also make sure that it's helping spur progress at country and community level. More broadly, health adaptation cannot be siloed. The transformative actions needed to improve health outcomes, health security, and health systems rely on climate resilience work both inside and outside of the sector. So we're keen to explore through this plan how it contributes and fits to the broader COP30 agenda and the work in the other sectors and plans. And well, no amount of adaptation will ever be enough if we don't actually tackle the source, the problem at source. We hope the plan will help influence COP30 ambition and action on emission and pollution reduction. The health community has an incredibly strong role to play in this, in advocacy, giving climate change its human face. It also needs to act itself, given the sector is responsible for around 5% of global greenhouse gas emissions. And there are many win-win solutions that we think the plan can help highlight and emphasize to improve health outcomes, build resilience, and contribute to climate gains like active travel, diets, and climate-resilient infrastructure. And this can be built out towards the NDCs and the NAPs that we so crave. So really, I just want to say, I look forward to exploring all these ideas, sharing experiences and perspectives, and learning from others across the next few days, and look forward to getting to a really strong agenda at COP30.
Thank you very much, Helen, and thanks to the UK as president of COP26, basically for all the leadership and for being the first presidency to bring really more visible the health issues. And again, we had the chance to have all of the leaders that continued with their presidencies bringing visibility to the health issues. And I think your point about basically making sure that we are able to influence also the COP30 and the ambition that countries will basically hopefully have to decrease the emissions is a very important point. And of course, everything related to multi-sectoral collaboration, it is also. Last point that I think is very important to highlight is the point about building on everything that is out there. And I think that is an intrinsic idea embedded basically in this multi-RAO and in this collaboration, participation, and principles that the Belém Health Action Plan already includes. But with this, I will give the floor then to Vugar Mamadov, who is the head of International Cooperation Department on the Ministry of Health, Azerbaijan. Vugar, the floor is yours.
Excellencies, distinguished delegates, colleagues and partners, first of all, we would like to thank you to the Brazilian government for hosting us. It's a great pleasure to join this important session dedicated to the Belém Health Action Plan. I thank all co-organizers for convening this timely and important gathering. As a host of COP29, the Republic of Azerbaijan placed people at the center of climate ambition. And the Baku COP presidency's Continuity Coalition for Climate and Health, established under our presidency, reflects our intention to foster long-term collaboration among past, present, and future COP hosts on climate health linkages. It provides a platform for dialogue, knowledge sharing, and aligned action while respecting the diversity of national context and approach. I am also proud of announcing that as a co-chair of ATACH, led by WHO, which brings together 19 countries and other supporters for action health climate related issues. We view the Belém Health Action Plan as a timely continuation of the momentum generated by the Baku Continuity Coalition on Climate and Health. The coalition demonstrated the value of sustained political attention and multi-stakeholder dialogue, and we welcome efforts such as the Belém Health Action Plan that seek to carry that work forward in a structured and inclusive manner. As discussions on the panel evolve, Azerbaijan will continue engaging constructively with partners and to contributing to the global effort to strengthen health system resilience in the context of climate change. We are looking forward to building synergies between Baku COP Presidency's Continuity Coalition for Climate and Health and Belém Health Action Plan, as this alignment reinforces the growing recognition of health as central to climate ambition. In this spirit, we remain committed to continuing these conversations, including the lead-up to COP30 and supporting initiatives that place human health and well-being at the core of climate action. Thank you very much.
Thank you very much, Mamadov. And thanks to Azerbaijan for continuing and for launching this Continuity Coalition. I don't know if everybody knows what is that, but basically last year, under the presidency of COP29, this coalition was launched basically bringing together all of the presidencies that have prioritized health during their presidency. So starting with COP26 until now, Brazil. And thanks for your commitment to continue working with Brazil, basically trying to strengthen how health is represented within the negotiations. With this, we will pass to now hear from representatives from international and multilateral organizations on their views on the plan. So first, I would like to invite Amban Pillai, who is the Deputy Director General at National Department of Health, representing the G20 presidency in South Africa.
Thank you. Thank you very much. Thank you to the Brazilian government, as well as the organizers for putting this event together. It seems Brazil's a sucker for punishment. I mean, you hosted the G20, you hosted the BRICS, and now you're hosting this. I recognize the effort given that we're doing the G20. I'm not sure I would want to volunteer again for anything. Thank you very much for this conference. As the G20 presidency, South Africa recognizes the importance of global solidarity. In fact, our theme for the G20 this year is solidarity, equality, as well as sustainability. to entrench the system of multilateralism, given that that's a huge challenge currently globally. Many of these challenges, whether we're talking about climate change, pandemic threats, or any of the others, require that we work in solidarity, we work with equality so that those who are least developed and can least afford to respond to this are supported, and that support is sustainable as we move forward as the global community. So with recognizing that, we have identified climate and health as one of the key areas in the health working group. We focus specifically on adverse weather events and health. There was a session on that at the Health Working Group in June this year. And we discussed particularly the impact that adverse weather events have on health systems. We had speakers from the World Health Assembly, from the World Meteorological Organization, the WHO, and various other experts as well, talking largely about the impacts that adverse weather events have. And central to that was the point that I think is in the Belém Declaration around early warning systems. If we're not able to identify early on that there is going to be an adverse weather event, health systems have great difficulty responding after the event has occurred or while the event is actually taking place. So early warning systems become key. We also spoke about the responsibility of care and support to those communities as they are affected by all of these adverse weather events. And secondly, what preventative measures can we put in place to avoid this, including systems such as artificial intelligence, systems that can predict these adverse weather events so that communities can be prevented from the adverse effects. And finally, the monitoring systems that should be in place to be able to identify the potential for a next adverse weather event. So we've recognized this, and these principles now are part of the draft declaration that is currently being discussed with G20 countries. I can say quite confidently that most of the G20 countries, or almost all, I say almost, as you know why, I think most countries would accept that adverse weather events have a serious impact on health systems, and we need to do a lot more in order to be able to respond to that. So I do think there is a huge support globally around this issue, and what I do think, though, is that more action needs to be taken in this direction. I think a colleague from Egypt emphasized that quite well, that the impacts of adverse weather events are moving at a faster rate than our response to it. And I think here the human behavior comes into play, right? We often wait for something adverse to happen before we actually are forced to spring into action to make some of the big changes that we have to make. But hopefully we can, as a human race, work together to respond to this before we come to that point where we're going to have these adverse weather events to this point. The other proposal we'd like to make is, I think it's important that all of the work that's being done in different organizations, whether it's through G20, whether it's through the COP or through the World Health Assembly, that somehow these are integrated into one sustained response rather than us trying to do this through different tracks. I think that's important. And then secondly, around the issue of financing, we really need to think of a more sustainable mechanism for financing. There are various models out there, but I think in order to get the inertia going in terms of what actions we can implement, really introducing a financing system that is sustainable, linked to the economies of different countries is important. So we really propose that we think about that. And then finally, I think on the issue of climate change and health, we need to support the Belém Declaration because I think it provides a comprehensive response to climate and health. And it's the first time that we've had such a meeting. And I was saying to Mariangela, that's why I'm here, because normally these climate and health meetings rarely involve public health people. And I think this is the first time that it does. And I do think we need to integrate colleagues from public health to be part of the conversation so that they can also take on this responsibility. Thank you.
Thank you very much, Mr. Pillai. And I think colleagues from Brazil will be having a bilateral later with you to see whether the Belém Health Action Plan can be also highlighted into the G20 declaration. So just wait for that, it's coming. Next, I would like to invite Mr. Youssef Nassef, who is the Director of Adaptation in the United Nations Framework Convention on Climate Change.
Thank you, Elena. And I must say I'm quite impressed by not just the content of the plan, but the amount of support that is being expressed for it. And not to be left out, you can count on UNFCCC for doing whatever it takes to help, at least during the COP session, to make sure that, that this plan gets the exposure that it deserves. So I won't repeat anything that was said before, and I totally associate with it. But things that I like about the approach that we're taking, I think the priority given to equity is a really interesting and necessary component here, not just because those who have the least capacity to adapt and are subjected to the highest level of exposure and have had the least contribution to the problem would be highlighted, but also because any transformation that happens will have winners and losers. And then we have also the notion of just transition well ingrained into this plan, which I think is unique, and we often miss this component in many of the initiatives that we've had over the past decades that have risen and fallen. And so it's good that from the beginning we have this component in there. Another good feature that we heard in the presentation earlier is that there's an expectation that this will be followed through at each COP session. So it's not just one big bang and then we never hear about it again. But it's really important to have that follow through and ensure that the promises that were made are being implemented. So I think that's good. The common terminology initiative there is really important. I was told once that any initiative that is multi-stakeholder will only work if all are looking at the same information base. And so with the terminology becoming common, with the integration of the information base, the knowledge base, the database that everyone's looking at, I think this is also an important factor of success. Now the anchoring in the Mutirao ethos is really important because Mutirao implies that we're looking towards a common goal, collective goal, without necessarily individual gains being factored in. It relies on community action. It's where everybody acts without the perspective of profit coming in at all. And I think this is something we need very much to be prioritized in the health sector. And we've heard before about the whole synchronization effort and the momentum and the interoperability and the holism that is ingrained in this effort. Now, what I would have hopes in ensuring that we also institute here in order to ensure success, first is a realization that the climate change process suffers from a crisis of communication. We realize that the public is desensitized. Just telling them you're all going to die and this is, all the bad stuff doesn't get people to move. The health community knows that very well. We've been saying to people, smoking kills, smoking kills, smoking kills. That's not what got them to stop smoking. And so I think the one thing that would be really helpful is devise the positive narrative out of it. The positive narrative cannot be that we're trying to make the world less bad. That just doesn't move anyone, not the public, not the policymakers. But here's a vision of how the world can become so much better when we do all this, when your well-being is enhanced, when you're in harmony with nature, when all aspects of health, human community, and even planetary health are addressed. So selling the positive vision at the end. But for that to happen, we also need to be able to articulate that landing zone. So when this succeeds, what happens in terms of numbers and when? So by this year, here's what we expect. So we can measure towards that goal. And I think that would be then the next step of articulating the next level of detail here. And you'll see a lot of words like improve this, strengthen that, reduce that. And I said, I think in my opening intervention, that to have a vision, it should really be articulating that final thing. So not a slight improvement, a slight reduction, a slight enhancement. But then if this is to succeed widely, is to achieve its maximum potential, then what's that optimized change and landing zone that's there? And articulating that very concretely, I think, will be really great. Even in our SDGs, there's only 2 SDGs with absolutes, which is zero hunger, zero poverty. With the others, you can really play around with statistics a lot to demonstrate progress. So we would like, I think, in this initiative to make sure that we have concretized the final target, the landing zones for all of them in as much detail as possible. Finally, on finance. You might have heard from the assessments from the United Nations Environment Programme that for adaptation finance, we needed to increase tenfold within the next 4 years. And this can't happen with grants nor loans for obvious reasons. With loans, then you kill people economically rather than killing them through climate change. With grants, there's a saturation already. It's not expected that these will be able to increase as exponentially as is needed. So creative thinking on how finance can be mobilized for health, which is a sector for which our starting point is actually really horrible, very low in terms of climate finance. So how to enhance it, not just enhance it to become on par with everything else, but way beyond as we move forward in the next few years, where ecological harm might also be increasing at the same time, and loss of life must be increasing. So I think this is a really important area where we need from the start to know what the plan to mobilize financial resources will be. And like I said, it cannot be done through what happened in the past. So what got us here will not get us there. It's a totally different mindset that will have to be applied here to make sure that, that this plan is appropriately resourced and can deliver on the concrete targets that it will hold. So this, I thank you once again, and best of luck on this. Thank you.
Thank you very much, Mr. Nassef. I don't know if you got it, but he offers support to all of us to make sure that health is better integrated into the negotiations. So I think many of us will be talking to you later, and maybe just to recall that Article 4.1.f of the UNFCCC back in '92 already included that all adaptation and mitigation policies and programs to be implemented by countries have to integrate health. So we want to implement that article, and we want the UNFCCC support to find an agenda item basically to discuss how we will do that. Also, thanks for highlighting this positive narrative, and I think the atmosphere and the passion and the motivation that we are seeing in this room is already showcasing how we are going to bring this positive narrative. And I would like to recall also something that was very beautiful, highlighted by Minister Silva this morning. It's not about creating a new way, it's about walking differently. And I think we are all together walking differently today. Let me invite now this very difficult name, Daphne von Buxhoeveden, who is the head of unit in the European Commission in DG HERA, which is basically responsible for Emergency Preparedness Response Authority. Daphne?
Thank you, Elena. You pronounced my name perfectly. So thank you also from our side to the Brazilian government and to the WHO for organizing this very important global conference on climate and health. I think, like Maria Angela said earlier, we are no longer in a situation where we have to assess whether we should act. We are now in a situation where we have to decide how we should act and how we can protect our most vulnerable. Within the European Union, we have established a quite comprehensive policy framework over the years with a climate law, a research and innovation agenda dedicated specifically to climate and health, a global health strategy, and a medical countermeasures strategy. And I was very pleased when reading the Belém Action Plan that the actions that we are proposing to put forward over the years to come are aligned with the Belém Action Plan and actually complementary. I think I would like to focus on 3 areas where I see in particular a high potential of collaborating further. And the first one is threat prioritization and surveillance. I think we're living in an era where health funding has become scarce. There are lots of competing demands, whether it's defense or security, and we need to prioritize how the money is being spent. And to do so, we need to have a clear understanding of what our threat priorities are. And to do that, we need to strengthen our surveillance system. Within the EU, we are investing heavily into global wastewater surveillance because it allows us to detect at the local and regional level at a rather low cost how diseases are spreading and evolving. We are also strengthening laboratory capacity both within the EU and in low and middle income countries. And we are buying and purchasing mobile labs that we will be able to deploy to remote areas to be able to also survey and analyze new pathogens when they emerge in areas where, for instance, you have no electricity. Once you know what the threats are, how diseases are evolving, you need to also look at what kind of medical countermeasures are available out there to protect your citizens from the diseases. And we have done this exercise within the EU, and this is something that the HERA, so the Health Emergency Response Authority, has been carrying out for the past years. And we have noticed, like many of you know, that for a lot of those diseases, even though they are affecting millions of people a year, there are actually very few vaccines and therapeutics out there to help our citizens. And that's, I think, where global collaboration is extremely important, where we have to work with multilateral organizations such as the WHO, CEPI, DNDi, Wellcome Trust, Bill and Melinda Gates Foundation, and many more, to pool our resources and to join our research and innovation funding, and to be able to help go through the different clinical phases 1, 2, and 3, and to invest in new products. The coalition that was launched by the Brazilian government on neglected diseases will definitely help us to put that forward, and also the IPPS is suggesting a coalition for therapeutics that is being discussed in the context of the G20 for the moment, which could also help in that regard. Within the European Union, we have financed the development of a new vaccine for chikungunya together with CEPI, which was authorized last year, and are currently investing together with the DNDi in the therapeutics for dengue. And I think it's this kind of very concrete measures that will actually make a tangible difference for our citizens. But the investment in research and innovation is not sufficient. You also need to make sure that those medical countermeasures can be accessed by people, that companies who are producing them overcome the valley of death, that we are tackling market failure. And for that, demand instruments are incredibly important. And we were super pleased to read in the Belém Action Plan that there's a dedicated section on stockpiling, because stockpiling together with joint procurement can guarantee a demand for those products. And stockpiling, in addition, can ensure that when you have a health emergency and you need to rapidly have access to life-saving products, they can be deployed thanks to strategic stockpiles that are complementary to contingency stocks. And then also, when we talk about access and availability, you have to discuss supply chains, which are also covered by the Belém Action Plans. You need to have resilient supply chains that requires diversification and investment in local and regional manufacturing. Not only investment in manufacturing, but you also need to invest in greening the manufacturing lines, because, as was said by my UK colleague, production of pharmaceuticals is actually a heavily polluting industry. And tackling climate change, we have to adapt, but we also have to tackle the actual causes behind it. Last but not least, the Belém Action Plan puts a strong emphasis on our workforce and our citizens. Again, that is something that we strongly recommend, because as we have seen during COVID, even the best vaccines and therapeutics, if there is no health workforce, there are no doctors, there are no nurses who are able to bring those products to the citizens, then they are of no use. So we need to invest in the training of our health workforce. We need to make sure that there is a continuity of care when the crisis hits us. And we need to ensure that their mental health is also protected because they are going through extremely difficult times when there is a health pandemic. And then when it comes to citizens, here we are facing a situation in Europe of increasing mistrust and disinformation. Again, if we want to be able to protect our citizens, we have to establish a relation of trust with them. So that is something that requires investment. We also need to ensure that our most vulnerable are sufficiently represented in the clinical trials that we are carrying out to make sure that the products which come to the market can actually help them in the end. Let me conclude, because I know the timing is short, that climate change and health is a shared responsibility. Diseases know no borders, climate change know no borders, and it's only by acting together amongst countries, but also with civil society and the industry, that we can present a better future for the next generations to come. Thank you very much.
Thank you very much, Daphne, and thanks to the European Commission, DG HERA, for basically reaffirming the priorities included in the Belém Health Action Plan and calling for even more synchronization of global actors and investors in research and innovation, basically to drive greater impact for their investments. With this, I will now invite Danilo Moura, who is the Climate and Environment Specialist at UNICEF.
Thank you. I think I'm the only Brazilian in this group except from Maria Angela, so my notes are in English, so I'm going to keep doing it in English. But I think I want to start by thanking the Brazilian Ministry of Health for inviting UNICEF to participate. Our Chief of Health, Luciana, was supposed to be here. She had a problem. She needed to be in Rio. She'll be here tomorrow, but she sends her regards. And I guess I'll start as other colleagues did by saying that UNICEF is entirely on board with the declaration and very happy to see the declaration move forward and to see that the work that has been done in the past few COPs to advance the agenda of climate and health is also moving forward with Brazil, is also moving forward in this COP. I won't repeat a few of the things that were already said. I think, in general, a few points that we wanted to make. First is, it's very important, I think, echoing Helen and Yusuf from the UNFCCC, to think of how this plan can become more than a plan, right? To think of how it can be monitored, to think of what is the timeline for this plan, what's expected throughout time, how can we know if it's succeeding or not? I think we are all probably aware of how many things that come out of the processes during the past few COPs, or even throughout the many years and many COPs. How many of them became just pieces of paper or nice sentiments that weren't implemented? So moving forward with having this be an action plan in the spirit of what the Brazilian presidency of COP has been doing seems very important. Two, well, I'm from UNICEF, so I guess I have to do the mandatory requirement of highlighting how children are particularly vulnerable, how the health of children is particularly vulnerable to climate change. And someone previously mentioned the GGA, the Global Goal on Adaptation. This year, the GGA is producing a list of indicators, and both in the indicators in the GGA, and I guess in the spirit of the GGA in general, there is an expectation that vulnerable people, vulnerable communities will be looked at with attention. And so for monitoring, for data, for specific actions, it's important to have age and sex disaggregation, especially so we can look at children, we can look at girls. Of course, we can look at women at all ages, and we can look at the elderly. Those are all people that are more vulnerable to climate change. And so including those perspectives, deeply embedding those perspectives deeply in the plan is super important. something else that I thought it was worth mentioning, because Daphne was just talking about synergies, and we should also be thinking about how to find synergies between the global sources or the global, the existing infrastructures for supplies and other key materials that exist in the world. I'm thinking of UNICEF, but there are many other organizations that already have several infrastructures, and sometimes there is a lot of duplication of efforts instead of integration of efforts, and maybe this plan could be an interesting space to try to connect all those things. Finally, I think it's we really would like to commend the plan as it looks now on how it's trying to find a balance between scientific evidence and traditional scientific knowledge and local and traditional and indigenous knowledge and community practice. And that's a crucial element of this discussion, and probably we should be thinking also of how to get our workforces, the health workforces, ready to, in emergencies, to respond at the local level, right? So how do we get workforces ready to set up mobile units and in community units, and to actually respond to emergencies within communities with partners, with those partners that are that suffer the most in most cases. I think that's it. Once again, I would like to say the plan looks fantastic, and it's brilliant that we are moving forward with this initiative. And it's really important that we think in how can we keep embedding those concerns for climate justice within all the action plans and within all the strategies for how to address climate change and how to adapt to climate change. And that means looking at the most vulnerable. That means, as we like to say in UNICEF, because that's our mandate, that there is no climate justice, there won't also be intergenerational justice, and there is no solution to climate there will not also be a solution for the challenges faced by children. Thank you so much.
Thank you very much, Danilo. Thanks so much for bringing the importance of having age and sex disaggregated data, basically to understand vulnerability, but also to design policies and solutions that will address those in the most vulnerable populations. I think also very important your point about synergies and making sure that there is no duplication, that all efforts, all initiatives come together in support of the implementation of the Belém Health Action Plan. With this, the two first discussions have come to an end, so I will invite all the esteemed panelists to come back to their seats, and I give the floor to the Master of Ceremony.
Excuse me, at first I ask you...
Com licença, primeiramente eu gostaria de pedir que ficassem de frente ao palco para que tomemos uma foto oficial. Ok, obrigado por sua colaboração. Nós pedimos que vocês voltem a seus assentos na audiência.
Ângela Simão, as senhoras podem ficar em cima do palco.
On the second session of dialogue, I invite to compose the head table, Mari Vieira, President of Fiocruz. Emma Patur, President of the World Federação Global de Saúde Pública. Mundial, Victor Gisal, President of the National Academy of Medicine of the United States of America. Angela Castellana, representative of COICA. Sandra Andrade, representative of National Coordination of Black, Rural and Quilombola Communities, CONAC. Sandra Patinho, Subsistency and Health Boss, Team of Amazonia Conservation. Marta Jani, of the Movement of Women of Pará, from the People's Couple Summit. With the word, our moderator, Elena Prats. Thank you.
The third consultation, and now we will consult with representatives from key civil society and academia representatives. I will first invite Mario Moreira to take the floor and please make some interventions on the Belém Health Action Plan. I need to be nasty because I've been required to request everybody to keep their interventions to 3 minutes, please. So, Mario, the floor is yours.
Boa tarde a todos e todas.
Good afternoon, everyone. I would like to salute the first Mariana Simão and Helena as the head of this table, and so I salute this head table that's most of it females. It's an honor to be here, but most of all, it's a great responsibility to represent one of the most important science institutions of this continent, which acts with a strong engagement, political engagement in defense of this agenda that we are today talking. Fiocruz have been centering this discussion as an agenda, as education and technology, this cross intersection about weather and climate. We are also an institution that, beyond this political incidents, among other areas of Brazilian government, alongside with the government and many areas of the society which we work closely, Fiocruz is also an institution that produce and develop technologies, social technologies that are very important in our part in this multirão, which we are taking part in national level, but also in production of science and hard science like vaccines and also medicines and medical devices, and also innovation, I would say revolutionary, as much as the developing of the mosquitoes infected with bacteria Volbacter that stops the spread of chikungunya, dengue, and they're mentioned here as a problems derived from, or at least a bigger part in the epidemiologic framework of the world because of the climate changes. We are also a scientific institution, thus we form a lot of students, a lot of people in Brazil, Africa, technicians, doctors, and PhDs, not only to strengthen the health system of this country, but to form a scientific base in a field of all the sciences of biomedical science, that the data shows us a singularity that is really favorable to the discussion of this agenda. The weather agenda and the health agenda. Thus, since it's fields that need interdisciplinary and requires a great effort of all the stakeholders that works in this field.
So we do not let it be dissociated. It's an important role of all of us here. We also have a very big tradition in working in different territories, in different communities. Brazil is today amongst and present throughout all the biomes. We are present in all regions, all states. We have works being done throughout many agencies in the Brazilian government, over 14 ministries. We work on projects alongside many national agencies, many international agencies as well. We also have representatives in Mozambique in the health field. We are also opening an office in Portugal to strengthen cooperation ties, structural cooperation that also brings with itself not only the development of great public policies and the development of the health system, but also bringing science and technology as a key factor to the betterment of the life conditions of our population. But focusing my speech on this development characteristic of technology, it's important to recognize that historically there is either in the health field as an environment a big discussion over the role of technology that at the same time is cause and at the same time it's a solution for many of the challenges met today on this intersection between climate and safety and health. Throughout many times, technologies have been claimed as transforming tools for whole transformation of massive transformation and disruptive innovation in the providing of services. The separation of these asymmetries on health access is fundamental piece of this process. I state here, I open a parenthesis, that's why Brazil has presented to G20 the idea of global coalition to the local producing coalition. It's about guaranteeing access. It's also recognizing that all countries have contribution, they have capacity that need to be activated so that we have a more balanced production in the world and a more balanced access to innovation. And for that, and everyone must be connected. Once again, I say the word multirão. I know it's hard, but in practice, we can put in some examples that can really represent this process. The technological advancement will only reach its goal if it's accessible by accessed by all. And today, it certainly isn't. We must think always under perspective to benefit the global population, and the COVID pandemic has taught us a lot. We can't forget that. It has taught us how much part of the population has been left behind on the separation efforts in regards to the pandemic. We cannot let it happen in regards to facing climate change. In health, the technological advancements are particularly celebrated by its potential to protect lives, increase treatments, recovery, alleviate suffering, and make life longer in good health. So even though these developments bring many funding agents, even though it has many failures, it can improve much more, and it can really improve the well-being of many sectors of society. So this feeling, this very great expectation, it frequently ignores the challenges that makes hard the transition between the promising experiments into public policies to really gather technological and scientific advance. That's what we've been working here. These challenges include guaranteeing that all communities have access to these innovations, to persuade governments to take risks to gather the risk of taking in new technologies and create the necessary systems to attend the fundamental necessities of those in need. The same group is related to climate. To the point of public health, we must recognize that the strategies in contemporary health can no longer neglect environmental dimensions of health. This is very important. So health practices must be integrated in all stages of policy making. Today we make 125 years, and our main mission is to generate knowledge and develop technologies that will work in favor of services and fundamental products. I state again, not only for Brazilian health, but a global perspective. Elena, as president here, I am going towards the end. We have a history of recognition on the relations of climate, environment, and health. We've been working on that perspective for over 50 years. We are deeply involved in COP30. As part of the health ministry, our researchers have contributed to the making of key documents. Through them is Bahisi Mareto, who will be speaking here through this conference. I also highlight the participation of Paulo Gadelha as coordinator of the Fiocruz strategy for the COP38 agenda. And internally, Fiocruz, throughout all our research actions and technological education, is part of the contribution to COP30's research. Fiocruz will turn its unit in Porto Velho and a climate and health center, including in a event who will be a part of the event of the health ministry pre-COP30. So that's an important point. And I leave the invitations to national partners and international partners who are willing to join this great project, national project. Another great initiative is the creation of the Synthesis Center in Health over Climate Change, the loss of diversity and pollution. This research aims to enlarge capacity of Fiocruz to respond to interconnected challenges of climate change, loss of biodiversity, in regards to pollution. I highlight a project we give lots of attention, which is popular surveillance. The Gadelha will have the opportunity. I will conclude now. This effort reflects the compromise of Fiocruz with the agenda. I expect to see most of you there at this COP that has everything to be a historical COP that brings health to the center of the discussion. Thank you a lot, everyone. Thank you. Muito obrigado.
Everybody had a clear understanding on the role that Fiocruz can have in supporting the implementation of the Belém Health Action Plan, not only as a national actor, but also as a global actor. And we also realize that keeping time might be a little bit difficult for you, but we thank you for your intervention. Please, let's try to keep the interventions to 3 minutes. You have a screen there showing the time that you have left, so please don't let me ask you. So I will invite now Emma Rawson Tepatu, who is the president of the World Federation of Public Health Associations.
E tu kahikatea he whaka
Speaking native language.
I've used up quite a bit of my time just telling you who I am and singing a song, but it's very important that I introduce myself to you in the way that it is native and indigenous for me. I've been sitting, thinking and listening to all of the conversation this morning, and I really don't want to give an intervention in the same way that has been given to you already this morning. I want to give you an intervention which is my existence. I am the president of the World Federation of Public Health Associations, the first Indigenous woman to hold that role. I'm also one of the newest expert members of the United Nations Permanent Forum on Indigenous Issues, beginning in January next year, and I sit on the WHO Civil Society Commission. That's just a few of my hats. The World Federation represents 5 million public health practitioners globally, and 115 plus countries are members of our association, and Abrasco is an associate of the Federation, as is PAHO. So I say this to sort of give an indication of the size of the impact that the Federation has. And as an Indigenous woman, it's really important that I say this. In a conference like this that's bringing together climate and health, as an Indigenous person, I say, welcome. This is not a new conversation for us. We have been talking about these things since the beginning of time. We have a lot of contributions and a lot of gifts to bring you, if only you will listen. It's interesting being asked to keep it to 3 minutes. It's interesting being at the end of the session. As an Indigenous person, Indigenous peoples, peoples of colour, we always get relegated to the back. And so our mission at the Federation during my presidency, and also during the time as Luis Eugenio, who I acknowledge as the past president of the Federation, we committed to decolonise public health globally. That actually means something that has been touched on by a number of the speakers already this morning in terms of changing the mindset by which we approach these issues. Understanding colonisation, and that colonisation touched just about everywhere on this planet. We need to understand what it means to decolonise the way we think, so that interventions like the Belém Agreement on Climate and Health can actually be realised for all of the people and all of the equity that we all so desperately need to see realised. It will not happen if we do not address and understand Indigenous peoples, indigeneity as a determinant of health, racism as a determinant of health, and all of those things that will help to rebalance and transform if, as a wider community, a global community, speaking the same language, speaking from the same songbook, aligning all of the plans and actions and all of the things that we have going on, and doing the same actions at the same time together to ensure that everybody gets what they need, how they need it, when they need it, in the place that they need it. So given that I only had 3 minutes, I think I put quite a lot in there, but just on behalf of the Federation, I can say that 5 million people, in terms of our immediate community, we would be very pleased to see a few more things added to the agreement that we're here to discuss, and that is clearly outlining indigeneity as a determinant of health. Indigenous populations are populations in their own right and should not be compounded with other marginalised groups. We should be seen as a group of our own, and there should be very clear guidelines around what needs to happen in terms of partnership with Indigenous populations. And that's just some of the things. So lots to talk about, lots to contribute. Thank you very much for having me. It's a real pleasure, and I look forward to hearing from my colleagues. Kia ora.
Thank you very much, Emma. I think with this I will invite Omnia to take the floor.
So hi everyone, Your Excellencies, Ministers and colleagues. I'm speaking on behalf of Dr. Jenny Miller, who unfortunately couldn't be with us. And we are representing the Global Climate and Health Alliance, an alliance of over 200 health organizations representing 46 million healthcare workers globally in every continent in the world. And we are united to tackle climate change and through that promote and protect health within the health sector and beyond that. We are very happy and we condemn seeing the Belém Health Action Plan, how it transitioned from a declaration of COP28 to an actual implementation plan that is co-created with countries, but also with civil society, academics, as well as Indigenous communities and vulnerable groups. There are 3 points we wanted to make. The first one is around and building on the clause that focuses on just transition within the action plan. Our role as healthcare workers is to make it clear to governments at COP30 and at the national level that people's health will not be protected unless we tackle the drivers of climate change. And healthcare systems will not be able to respond if we do not tackle these drivers. They will not be able to respond when the temperatures exceed 3 to 4 degrees. In 2024, we saw how it exceeded for the first time, and this will not be the first year and not going to be the last year that we're going to see that. If countries and governments continue to delay climate action, backtrack on their commitments, and open up new oil and gas reserves, which are furthering damaging our health and the health of our patients and our people. And now we have seen with the International Court of Justice that countries do have an obligation to prevent the degradation of the environment and drive climate change. And this is why GCHA in September we are going to publish our report From Cradle to Grave, looking into the health implications, the health toll of fossil fuel, and how can we create an imperative for, more importantly, a just transition, and how to move away from being dependent on industries that do not serve our health and instead look into the energy efficient, cost-effective solutions and sources of energy for our development. Another important thing is that we see how health is constantly mentioned as a co-benefit, especially with emission reduction. It's not. Emission reduction is centrally about protecting and promoting the health of the people. Second point, which Dr. Yusuf has brought up around finance, we know that adaptation finance is lacking, but even more, less than 0.5% of total climate adaptation finance goes to the health sector. And how much does the health sector need? And this is according to a recent study in 2015 from the Lancet Countdown. The health sector on its own in developing countries needs at least 11.1 billion per year until 2030 to be able to adapt. And we know that the COP30 presidency in Brazil are going to push for doubling adaptation finance this year, but we also need that the adaptation finance, while it is being doubled and pushing countries to do that, that there is a fund that is earmarked, that is dedicated for health and for health as a sector standalone, not under the umbrella of infrastructure and not within other areas, and how to think about innovative financial instruments to be able to do that. Finally, around inclusion, and we talk about resilience, but we cannot forget quality and coverage. We need to, and I emphasize what Danilo said, there is a specific section on gender-specific indicators, but child-sensitive indicators are so critical, and not just the mention of children. There is a diversity of life course and impacts of climate change that happen from neonates to not, to children, to adolescents and young people. And similarly for indigenous communities, indigenous knowledge, especially when we talk about mental health and the ways that we connect with nature. And then finally, we need to connect agendas together. We know that quality, efficiency, access, and coverage is within universal health coverage. We know that health systems are the front line of addressing climate change, and we need delivery and universal health coverage to be connected with the climate agenda. That's it from us, and as the health workforce, as the Global Climate and Health Alliance, we stand together with countries to work hand in hand to not only implement the Belém Health Action Plan, but to also protect and promote the health of our people together. Thank you so much.
Thank you very much, Omnia. Let's go with the last speaker from this discussion on feedback given by the civil society and academia to the Belém Health Action Plan. Victor Dassau, please, the floor is yours.
Thank you very much. I do want to start by acknowledging Agnes Flores and also Mariangelo Simel for their great work, Brazilian leadership to get us to where we are today. So, you know, the Belém Action Plan, if implemented, can put health at the center of climate action. It should integrate health into national adaptation plan, nationally determined contributions, and COP negotiation. I speak on behalf of academia because we, academia, universities, research institutions, education institutions, do work in science, research, provide the evidence for policymaking, innovation, and of course, education. Now, the academies around the world are very active in this area.
For example, in UK, the Academy of Medical Sciences, the Inter-Academy Partnership, of course, for me, from US National Academy of Medicine. We not only write reports, but actually we actively work with the government, with private sector for action. We convene public, private, government, industry, philanthropy to look at how to move things forward. For example, at the National Academy of Medicine in the United States, we have a grand challenge. We've got decarbonization of the health sector, working with hospitals, supply chain, academia, and others. Because in government, we work with vulnerable communities, co-produce solutions for vulnerable communities, system transformation across sectors, not only in health, but also agriculture, transportation, built environment, and others, look at how to put health in the center, research looking at low and middle income countries, and of course education, in educating the workforce. So we academies can mobilize and certainly commit to supporting the Belém Action Plan. When I look at the plan, I think they look at action number 1, integrate health, climate, and environmental surveillance, climate-related risk and disease and preparedness. Obviously, all this will require data, collection of data at national, subnational level, but also local level with indigenous information. Here's where the academies can help, because we can bring in science, data analysis, geospatial mapping, forecasting, modeling, and AI, of course. On action 2, when you look at policy strategy and capacity building, well, you know, the issue of adaptation and mitigation strategies require data. The work on vulnerable population, all these require data and evidence, work done by many investigators, including, I think, Mauricio Barata here in Brazil, who provides really important evidence for policymakers to make decisions. And of course, in workforce, we at the National Academies Project have an education working group on educating doctors, nurses, also working with Cecilia Sorensen on the Global Consortium for Climate Health Education that actually educates community health workers, community leaders, and others with a large network of partners across the world, educating hundreds of thousands of learners. In innovation, because there's no question that we're about innovation, particularly looking at tools which are affordable, sustainable, and effective in local context. So finally, I would say, yes. The good news is that we all believe that academies can be helpful. And I can tell you that, in fact, with Brazil Academy of Medicine and National Academy of Medicine in the United States, with Elliot, Ruscala, and others, we're now convening all the academies of medicine and science, basically medicine, internationally, in a meeting in September to commit to this whole area moving forward, to work with all of you to go forward. And hopefully we'll be all at COP30 to support the Belém Action Plan. So academies can commit the following: ensure science-informed local action and global coordination, promote climate and health education, and develop solutions and innovations. We look forward to working with all of you and deeply, deeply committed to working to move this forward. Thank you very much.
Thank you very much, Victor. So with this, our panel on civil society and academia is over. We heard more support to the Belém Health Action Plan and also very important points on the role that not only the International Federation of Public Health Associations, but also indigenous communities have to play. And now we will continue the discussion and hearing back from grassroots movements, indigenous and traditional communities. I have the pleasure to invite Angela Kashuyana, who is the representative from the coordination of organizations of indigenous communities in the Amazonia.
Muito obrigada. Gostaria de saudar a mesa.
Thank you very much. I'd like to salute the panel as a woman to be reverenced. I would like to speak as a place as an indigenous woman, that the Belém Action Plan is a landmark, but it's not complete. I say because this panel should have scientists, indigenous scientists, and also non-indigenous scientists in health area. So I didn't bring some sayings, but I have some reflections, some thoughts that I want to share, so I can have a plan that is complete and then can really aggregate with all people and people. So we really need to talk about climate and health together. Talking about directly financing, it's a little bit controversial if we're not talking about the people, if we're not talking about humanize the strategies. And humanize is to deal with the spirit, the soul, the culture, the knowledge, and also deal with the knowledge of the indigenous people. Someone said earlier that we don't have a solution for global warming. We, the indigenous people, we have is to create landmarks as a policy. We know how to deal with the global warming with conservancy and zero deforestation in Amazonia and whole the world. That's how we deal with the global warming. So it's necessary for us to think about the indigenous knowledge and science that we can build a complete plan. It's not good to only mention the participation of indigenous and quilombolas people and minorities. We should ensure that this knowledge of these people are aggregated as a main part and a strategic way to have an efficient plan that aggregates everybody to a solution to the climate crisis. It's really necessary to we should decolonize some thoughts. To say that we are more vulnerable people. We are not vulnerable people. We are people that are put in a situation of vulnerability. There's a huge difference, because when we talk about a plan, building a plan of access to health as an equal form, it's a little bit too much, because the Amazonia where I'm from Pará, but I'm not from Belém. I'm from the state where the COP is going to happen. It doesn't access in an equal form the health. To have access health in the border of Brazil and Suriname, you should travel 5 days to have access. So it's necessary for us to bring humanity to an efficient plan. We will be together building, but with this perspective. And to conclude, I must say that we can go further and prepare the next COPs, if not with the indigenous knowledge and science as a main center part of dealing with the climate change. Thank you very much.
And thanks for these remarks and this very concrete recommendation on how to strengthen the getting to aggregate the knowledge and the experience that is available already in many traditional communities and indigenous communities, and also a call for highlighting and proper use of the language, not referring to vulnerable communities, but communities that are put in a vulnerable situation. With this, I would like to invite Sandra Andrade, who is the president of the CONAC.
Bom, eu falei que não ia cumprimentar o Ministério.
I said I wasn't going to commend the Ministry of Health, but I have to do this. This is a first initiative. That's the first time the ministry has put health on climate change involving diversity. Wow. CONAC, the national coordination, is the biggest black movement in fighting for Earth on Latin America. Today, CONAC has done a very big fight over the preservance of territories. CONAC is part of CITAFI, the Afro-Descendant Coalition of Latin America and Caribbean, a union of 16 countries who fight for the preservation of their territories. The Quilombola population is essential to the preservation of the forests and all of Brazilian biomas. We are guardians of biodiversity. Amazonia is also black. Data by INSA and by MAP showcase that in 40 years, Quilombola territories are the ones that most preserved native vegetation, preserving 97% of its areas. Even though 94% of quilombos are taken by territory conflicts, the experience over the life of quilombolas is tinier than the general population. The average in age is of 34 years old, and the mortality rate by diarrhea, malnutrition are tripled in regards to general population. 94% of quilombos don't have access to basic sanitary measurements according to EBGA. All these data showcase that the Quilombola population is at the margin of the public policy. The Quilombola population has suffered gravely at the pandemic. It died 105% more than the general population. We had to get to STF to get rights to vaccines and we survived without traditional knowledge, our herbs and our teas, until we were able to get the vaccines. Our fight is for that SUS get within the quilombos, for it has not yet. That's why we want that the health ministry do their work, and with the compromise it has made, so that through the first time a national policy regarding the Quilombola population. We are more than 8,000 communities over Brazil, and only 500 entitled. We need to advance on the titulation to be able to maintain their territories, to be able to continue fighting the climate crisis, meaning that we being the ones who suffer from it the most. Thank you.
I think our colleagues from the Ministry of Health are getting another very specific request to tackle and to address the health needs of the communities that I don't know how to pronounce, Quilombola. Quilombola. With this, I will invite now Sandra Pachinho, who is the head of livelihoods and health at the Amazon Conservation Team, to make her intervention.
Boa tarde. Yo voy a poner.
I'm going to be speaking in Spanish. The action plan of Belém is a milestone on justice climate at the center of global health. Recognizes that global change is not only a climate crisis, we're talking about a social crisis, cultural crisis, and sanitary crisis, which hits hardest populations who are in a situation of vulnerability. As it's been said, the previous speaker, that shows that this plan is local. It's not universal recipes. Adapting means to listen, to know, to understand the territories, its cultures and its realities, to be able to build truly fair solutions who are resilient. This plan has many aspects that are worth highlighting, and it's been done throughout the session, but I'll enter some that might not have been coded, which is the time zone. We'll celebrate mental health and psychosocial as pillars of adaptation, because there is no resilience possible without tending to the mind and to the social context. We put here its bet on socialization. This is a concrete proposal facing the challenges we have at the moment. The plan also recognizes the voice of indigenous people and local communities, which are key to a true transforming response. Not far from this, there are some challenges. One of them is to go through the risk that in the declaration it establishes a financing milestone as mechanism followed by conciliation. We also need to make concrete how this theme will be integrated to these traditional methods in regards to alert in health system and to the decision makers in health system. So we need to work a lot throughout these days. Also is looking to define concrete indicators to sanitary measures and specifically to approach things about populations affected by climate change. Specifically, it's needed to strengthen the focus of One Health extending to a spiritual health, because if we're going to say that about indigenous people, spiritual health is not a complement, it's an axe of the well-being. And to put it on the axe of health, when we talk about health, we will not only talk about the physical body, but also spiritually, and the sacred relation that exists throughout territories and to the communities. So this is very important in this extension of this concept. Through my organization and throughout other civil society organizations, we believe that our task is to convert this plan in practical action, and we can do this with a leading plan of with localization, with a previous alert system that cover epidemics, water, connecting science with community vigilance surveillance, integrating ancestors' health and spirituality on health systems, respecting, obviously, local knowledge, putting up, focusing on gender equality. It's very important that human talent in health has a intercultural focus, because if we're going to work through local communities and indigenous people, they must be known. There must be communication channels who are adequate to, so that what we can think here reaches these communities. Besides, it's very important that there are, we see the opportunity of supporting the generation of these routes of action as a base through which we see advance, we make adjustments, because of course, all countries on the regions, we are not at the same breaking point. This Belém plan reminds us that there is no health without planet, and there is no climate justice without giving voice to all those who don't have it yet. And to rapidly conclude, I bring a speak that mentioned a indigenous public health agent that says the world is a big bucket that's hurt and has holes in it. A single man cannot fix it, but that this working day will not come to some people working. We will come together repair this big bucket we share. Thank you so much. Thank you, Sandra. Por último, vou convidar.
Make her intervention from the women.
Salve, gente. Marta Gianni.
I'm Marta Gianni, and feminist and infirmary. I live in Belém. I am from the Forum of Women from Pará, Articulation of Brazilian Women, and from the Movement for the People Communities Health, right now representing the People's Couple Summit. So we've wondered, in times of COP30, we wondered, Who are those who profit and who are those who sickens? We have much to say. Our rivers, Arari River, for example, from Marajó, agrotoxics from the rice plantations destroying everything. We have the women's bodies harmed, sickened. Children don't even get sick on northeast of Brazil. A matter also over agrotoxics. We also have the question of environmental racism. In times of COP and organizing the town to welcome the world to it, the rich shit is being thrown at the Vila Baca. So, talking of such, we wish to say that one of the questions that guide us here to prepare us to this speech, how can the voices of these communities be included in a meaningful way, and the implementation and design and monitoring of the health plan of Pará de Belém? We want an effective participation of the Amazonian people in climate policies. We wish to put that our speech will put here the guiding axis of the People Couple Summit, and the sixth one says about popular feminism and women resistances on territories. So we want to emphasize this axis, which is to defend women's rights and women's and girls on social environmental struggles to build and support popular feminism, anti-racist, anti-colonization, and through sexual and gender diversity and for women, race, ethnicity, and territory. To resist through the advancement of time, I'll skip some. To resist in front of the advancement of militarism over women who live and occupied on the matter of apartheid and war. There is no war, famine all over the world, with public policies directed to women in climate change, considering that they suffer this impact in a differential manner in their work and daily life, be it acting directly where these chemical products that enrich a few that live in this world this moment, be it indirectly or outside of these places, they are targeted potentially. That's why it messes with their reproductive matters. As my time has run out, I'd say the following. Our struggle is daily, is made daily. Our life and health is no merchandise. Our fight is daily. Our life and health is no merchandise. Thank you, everyone.
Much. I think with this we finish the panel. Thank you.
Uma salva de palmas, pessoal. Vamos a
A round of applause. Let's thank the presence of this table with such rich words and speeches. We ask that the components position for an official photo in front of the stage. While this, I'll be brief with one more announcement. While lunch is being served at the restaurant located at the 3rd floor, reserved areas of the restaurant are available for minister and ambassadors of the ci-dessou restaurant. After lunch, the participants must direct themselves to the laboratories and to the work groups that will begin at 3 p.m. Once chosen, it is needed to stay on it up to 5 p.m. when it will be done. Have all an excellent lunch.
Ladies and
Senhoras e senhores, boa tarde. Nós convidamos os participantes que ainda estão fora do auditório para
inside, we are about to start. Sejam bem-vindos à Onda Estratégica, alinhando as soluções dos grupos de trabalho com a agenda de ação da COP30. Esta sessão busca alinhar as principais soluções debatidas nos 3 grupos de trabalho com os eixos estruturantes da agenda de ação da COP30, promovendo sinergia entre as propostas e os próximos passos da conferência. Teremos contribuições valiosas dos facilitadores dos grupos, seguidas de uma síntese estratégica da coordenação geral da agenda de ação da COP30. Convidamos ao palco a moderadora da mesa, Agnes Soares da Silva, diretora do Departamento de Vigilância em Saúde Ambiental e Saúde do Trabalhador. Convidamos também ao palco Marina Romanello, diretora executiva do Lancet Countdown, facilitadora-chefe do Grupo 1.
Of Group 1, we invite Daniel Booth, Chief of Climate and Environmental Determinants from PAHO, moderator of Group 2. We invite Vincent Bretin, Director of Climate and Health from Unity Ed, Chief Moderator of Group 3. We invite Bruna Cerqueira, General Coordination of COP30 agenda. You can see it, and I will pass the floor to our moderator, Agnes Soares. Testing sound.
Technical problems like the rest of the day. First, I think we are coming to the last session of a very busy day. And I don't know about you, but I'm very happy with this wonderful day we had. Since the beginning of the first session, I think when we had all these people coming here and making this commitment to working together to have this beautiful plan that will really bring into action what we need to do to make the health sector work together and bring health at the center of the discussion of climate change. But now, what we are going to do is to look at the very last part, and I would like first starting by apologizing for the problems we had during the groups. I know that some of the things didn't work out, and I think we will have much more time to work in the groups tomorrow, because today I think everyone had so much to say that nobody paid attention to the time when it was counting, and we planned a very packed agenda, but I believe tomorrow everyone will be a little more relaxed. We'll have time tonight to relax and talk a lot with each other, so I think we will be following the agenda accordingly. But today I would ask you to just stick a little bit longer, and I would like to invite the groups, the coordinators of the groups, to tell a little bit what it was discussed, how far did you get, and what we can take from today. And we will have a very, I think it's a very nice way of closing the day. We'll have Bruna Cerqueira here with us, and she is the one that is in charge of taking the adaptation agenda of COP30, and she will guide us a little bit how all the work we are doing here will be matched with the work we need to deliver at COP30. So I think we will all understand what we are doing here and how exactly we should be working in the next days, so we do the best job we could do to deliver the action agenda that we need to deliver to COP30. So I'd like to start with Group 1, with Marina Romanello.
Excellent. Thank you so much, Agnes, and thank you to all of those who contributed to work in Group 1. We had really interesting discussions. It's always a good sign when you cannot stop the discussion because people just will not disengage with the conversation. So it was a really, really engaging conversation. We started off with a presentation from Boston Consulting Group that I believe was done in coordination with Gates, talking a bit about the risk of malaria and how climate change and the multiple climate drivers are driving risk of malaria and what that is doing in terms of control efforts and the extra challenges that climate change is posing on what is a deadly disease, one of the most deadly diseases. We then heard from 2 ATACH country members on their efforts in terms of early warning systems and response systems, both in Nepal and in Bangladesh, offering both insights on the solutions that they found and how they could bring together data from different sources to produce good surveillance and early warning systems, but also sharing some of the challenges that they faced and some ideas for solutions that they have come up with also in consultation with their stakeholders, which were really inspirational for the rest of the conversations that we had. Now, arguably, I was not in the 15 tables, so I'm just going to report on what I heard from a few of them. But as I said, the conversations were really engaging. We discussed the surveillance and monitoring part of the action plan, and particularly the first activity that has to do with strengthening surveillance systems, strengthening data infrastructures, and strengthening how those surveillance systems can turn to early warnings and can therefore generate protection of health. Some of the feedback that I heard from many of the discussions that we had was, firstly, no surprise to anyone, the urgent need for integrating data sources from different sectors. Crucially important, I think everyone acknowledged how challenging that can be, but the need for generating cross-sectorial working groups that can help activate and deliver on that integration of data and surveillance and monitoring. We also discussed a bit the need to incorporate also an element of response to that section so that we don't just put forward surveillance and early warning systems, but we attach to that what we're going to do about that information. How can we ensure that the information translates into action? And also discuss the importance of integration across sectors in the response. I particularly heard a very interesting conversation about disaster risk reduction and all the learnings that go into disaster risk reduction and the opportunity for better integrating climate change and disaster risk reduction responses. Interestingly, we also talked a bit about evaluation, and I think that is where we tie it back to COP. How do we ensure that our early warning systems, our response systems are effective, and how can we learn from our experiences from countries implementing these systems to refine and ensure that we are protecting health? And that goes back to the global goal on adaptation and the indicators being developed there that can be really useful in terms of evaluating actions, but also to the WHO's global plan of action and how the WHO is also generating robust indicators to ensure that we are surveying and evaluating the extent to which adaptation is protecting people. The other thing that we talked a bit about is community engagement, which is a critical element of this action plan. And one thing that's stuck with me is the critical need to ensure transparency in how the data is being used, so that when we engage communities in providing us with the data, in doing that surveillance efforts, in reporting, it's very clear how that data is being used and what benefit they're getting from those surveillance systems. That reinforces trust in the systems, encourages further engagement with reporting systems, and also builds transparency. And the last bit that I will mention, slightly detached from, perhaps from the discrete questions that we had, but I think very important also in terms of minoritized communities and how to make this accessible, is the need to look at integrated care. So when we look at how care is being provided in response to early warning and response systems, how can that be integrated into other aspects of community care to ensure that it's accessible to people, that is desirable, and also it enables access not only to a treatment or a solution for one discrete climate hazard, but a more integrated aspect to response and delivery of care at the community and local level. I think I'll stop there.
So we could go. So thank you for keeping the time. So we have more time at the end. Daniel?
Thank you so much, Agnes, and thank you for trusting in us this very challenging role, right, of working with 170 persons and trying to discuss and go through all these topics that are going to be built and embedded in the Belém Health Action Plan, based on the energy and the enthusiasm of people like in Marina's group, I'm sure that we're going to get an excellent Belém Health Action Plan. People are really engaged, really happy to provide their inputs, and I really thank you for that. And also thanks as well for our co-facilitators who are helping all the tables and to keep track of the discussions and the rapporteurs in each table. We started in working group 2, listening to 3 amazing presentations, one from Cecilia Sorensen, GCCHE, and then 2 ATACH presentations, one Canada and one from Nepal. One of the things that came out of these presentations, but also in all these groups, was the need to take a whole health system service delivery approach, and where we can clearly identify the risks, the current risks and the future risks, building early warning systems, and then that's how it probably is connecting as well with group 1, identifying which populations and persons have which specific needs and try to tailor the response to each of these groups. So the best examples that we saw and the best discussions that I could hear was when we have a problem-solving oriented approach. So focusing on communities, focusing on what are the problems there. Let's not wait until we have a silver bullet to solve all the problems, until we have the best methods to tackle everything at the same time. Let's not wait until we have the best evidence to do all the actions that we need, but let's do what we can while we advance. And that thing can help us to inspire others. And the successful stories that we heard, they're really inspiring. And I think that some of them are maybe easily adaptable to other situations. So then the ATACH, for example, serves well as a platform to collect all successful stories, but also the barriers, but also what's preventing us from moving forward quicker. And I think that that's something that we are hearing very specific suggestions on how to address those things. And one of them is about training of health professionals as well. One key community, or one key audience maybe within the health community would be community healthcare workers, because they are there, they are seeing the problems, and we should instrument these people with enough knowledge, but also with enough tools to learn to identify environmental and climate risks in advance, and especially to help preventing things from happening, preventing exposure. We are always very reactive, right? After a hurricane hits, then we do something. After a heat wave, then we try to, provide some service care. But we should do better with prevention through the early warning systems, through risk communication, but also on making sure that healthcare professionals are well instructed to recognize these problems, that health infrastructure is also intelligent, smart, to be able to adapt to the conditions that are coming. So if a region is being struck by a heat wave in the next 3 days, and if the health professionals know what are the symptoms and maybe already anticipating the surge of people who are going to the hospital seeking medical care at that point, then the health system needs to have a way of anticipating that, also doing a better risk communication to these communities to prevent exposure in the first place, and then reducing the bottleneck that we're going to see in the end at the health service level. And it's very important that we provide, that we can train healthcare workers so they can provide better care, especially for people in condition of vulnerability, depending on each. And you also have to learn how to identify the risks that are associated with climate change, that are multi-hazard, and then tailor the response and identification of which are the specific populations in situation of vulnerability for each of the topics. If it's a dengue outbreak, it's different than a heat wave, and we need to identify in advance who are the people that need that risk communication, that specific treatment or care after the facto, but also the prevention that should come before it happens. So the other thing is that healthcare workers need to take care of their own health as well. So they have to learn what are the risks associated with climate change. So healthcare workers can also take better care of their own health so they don't get sick in the midst of a crisis. So then that's a little bit that was discussed on some ideas that happen there, that should happen there. And to improve service delivery, we need to understand at each healthcare facility level, who are the communities that are being served, what are the potential risks to that specific healthcare facility, to the healthcare workers as well, and then making sure that we have these contingency plans that are tailored to the local level as much as possible so they can serve better the population that they are supposed to serve, and with the proper language, with the proper way of communicating risks and protecting the health of those in need. So I think we're going to come up with specific solutions. I hope that we can keep the same energy tomorrow and having maybe some extra 20 minutes to finish these discussions before we jump in the other two topics that are going to discuss tomorrow in Group 2. So thank you very much once again, Agnes, for trusting in us this very important responsibility, and we are happy to support you. Thank you.
Okay, and thank you again for keeping your time. So Vincent, you have the Group 3.
Thank you very much, Agnes. And like Daniel, I'll start by thanking you for the trust in us, the group, the facilitators, thanking the participants, because we had, similar to your groups, a lot of energy, a lot of enthusiasm to discuss, a lot of difficulty to cut the conversation at the end, which is a sign that indeed there's a lot more we should be discussing. Our group was discussing innovation and production, which is the third line of action. And specifically, we started with resilient infrastructure and the question of how to integrate climate in disease or immunization programs, in health programs in general. So two subtopics, but already two big topics. And we started with three really illuminating presentations related to three regions, the Amazon region in Brazil, Nigeria, and Vietnam, each bringing very concrete examples of how you can design programs that achieve those objectives, how you can improve the resilience of infrastructure. Interestingly, not just health infrastructure, but schools as well, because those same issues of flooding or heat will have the same impact in a primary healthcare facility or in a school. And some key lessons were shared already from those examples around, first of all, the very concrete solutions. So there are ways to do this that works, that delivers benefits, that can be sustained, that can be scaled, and those were really great examples. I was struck also by even though the solutions look simple when you look at a presentation like this one, the amount of learning and adaptation that was involved in those programs. And the examples provided were, initially the thinking was, let's repaint the roof in a light color to reflect the heat. But then we're talking to the community feedback that if we paint, we need to maintain. So what does it mean? We need to repaint every few years, and that's going to be hard to do. So instead, why don't we put a material that doesn't need as much maintenance but achieves the same effect? And that's one example of having an initial idea but then adaptation of the program to the needs of the community. Other lessons from those examples around, for instance, is it going to cost more? So to make all those facilities resilient to climate change, are we going to increase the cost in a context where the cost, is a big constraint, obviously? And from those experiences, there are solutions that are not very costly and that can be implemented and deliver benefits. And finally, integration came up as a very strong component. So how to integrate different sectors, different types of activities in those programs. So this is what came from the case studies from ATACH. And then we moved into the discussion. Obviously, what I can feedback here is just a small part of the discussion, so take it with a big grain of salt. It's an appetizer of what will be provided as feedback later on. We'll also need a bit more time, probably tomorrow, to finish those conversations. But just sharing a few highlights to give you a sense of where the conversation is going. First of all, on the question of resilience of infrastructure. I think there's a recognition that there are opportunities and barriers when it relates to the workforce itself, and the need to train the workforce in order to have a resilient infrastructure. There is technology available, but sometimes also a lack of availability of technology. So a lot of questions around how can we make the right technologies available in the right place. Engagement of communities, and I hear this is coming also from other groups, but putting communities at the center. And one of the questions was, how can we be innovative in making health systems more resilient to climate change and infrastructure? And one of the proposed solutions was, let's put communities and traditional communities and indigenous communities at the center. Let's start with that, and that in itself is an innovation. And design the entire program, the entire set of technologies and innovation based on the needs of those communities. Around technologies also, when we think about infrastructure, like one of the inputs was, let's not forget that supply chains are a big part of the infrastructure. It's not just about the facilities. And there are lots of things around supply chains or products, like regional manufacturing, for instance, as a way to diversify the production and make sure that we don't depend on one country, for instance, for the entire world to supply one type of medicine, or using heat-stable products that are more resistant to different storage conditions. One interesting comment as well on technology was when you think about telemedicine as a potential solution to provide services to remote communities, the question of whether there is a risk that by using telemedicine, we lack the understanding of the local context. If someone from a different region is providing services through telemedicine to another region, is that going to be sufficiently informed by the local community, the local context? So a potential risk, barrier, and consideration for technology. There was a range of questions around which criteria should we use to prioritize the work on infrastructure resilience. And so things that like, how distant are communities from health services as one criteria to prioritize opportunities. Another one around access difficulties or specific settings like mining, for instance, settings where some of the access to health is already potentially a challenge. And really helping people also stay in their communities. So it's making sure that as part of this resilience and resilient infrastructure, there's also a way to help people stay where they live. The final part of the conversation was around how to bring climate in health policy. So in disease programs, in immunization programs. And I think there's broad recognition that this is really important. This needs to happen. This needs to be captured in NDCs as well. So making sure NDCs reflect health priorities, health programs, that every disease program has their own contribution to NDCs. Integrating data, I think that came up from group one as well, but integrating climate data, health data as a way to inform those programs, and also disaggregating data by region, because regions will have obviously different contexts, different issues, and different priorities. One Health as a way also to bring together different issues and different sectors. And very concrete examples, when you think about immunization, for instance, potentially adapting the calendar of immunization to the local climate conditions. So if it is known in the area that there is a specific moment of the year where it's going to be likely difficult to provide services because it's a period of hurricanes, for instance, adapting the immunization schedule so that it doesn't happen in that period where we know there is a significant risk, which I found as a very concrete example, a way to adapt health programs to climate risk. And then financing as a barrier, but something that needs to be put in place, and in particular financing community health workers. So again, this is just a snapshot of a few points I could grab thanks to the co-facilitators of the session. There's probably a lot more that's going to come through the digital platform, and with that, I believe we'll have a lot of input for consideration to make the action plan even stronger. Thank you so much.
Thank you very much. And I think if with such short time you had sufficient talk for 10 minutes, I believe tomorrow we will need to have more time to report if we do that. But this means we have a lot to say, and I think I truly believe that we will have a plan that is really strong and that will manage to get all this energy into one direction and do what we do best in the health sector. We put things in movement and then we get to solutions. So that's it. And I know we have Bruna Cerqueira that will speak about things, but I believe we have a very special situation here. Maria Neira, she would be here with us, and she was going to be moderating this session, but she will enter online. I just asked if she's already online, and I see Maria Angela Simão is coming. I must say, Maria Angela will speak first if Maria Neira is already online. Because Maria Neira, for those of you who have followed this discussion on climate and health, I think we all know how important she is for our community. And for this, I think because of this special moment and that she should be here with us, we'll have some time, and I will ask, I think many of you know her from previous work, and I believe anyone who went to COP 26, 27, 28, 29, and knows how much she has been involved, and she has been pushing us to work in this direction, to bring health in the center of the discussion of climate change. So I will ask Maria Angela to say a few words, and then we ask Maria Neira to speak up if we can have her online. Okay. Maria Angela.
Oi, Maria.
Oi, Maria. Hi, Maria.
Speak in English, okay? But she understands Portuguese, you know. Yes. Maria, we missed you in Brasília. We missed you very much, you know. And I know you're retiring, but like me, you're not really retiring. No, so that you know, I retired from WHO in end of 2022, and I'm here. So, Maria, I'm gonna say one thing that I always say to people who retire or who have new plans for life. You remember people my age, around our age, because we're closer to age than most people here. You know the Eagles song, Hotel California, when they say that you can check out anytime you like, but you can never leave. I'm sorry.
Maria, I think there are no words we can say how much thank you for your work and how much you inspired all of us. And I think anyone working in the field knows how important you have been to all of us and for this agenda, and to really be the motor, like the one who was always pushing things and having all this media, you know, pop star that was Maria Neira. I think you have a competitor here with our Minister of Health, but I think she changed the way of communicating, and I think this helped a lot to put our agenda in the global health agenda, and so high that I think we could we can see now all these people engaged in this conversation. So thank you very much, and I'll give the floor to you to say a few words to us. We're here in Brazil with you. The sound. Can you open the microphone? Yes?
Can I talk?
Yes.
Eu fico muito emocionada pelas suas palavras. A tradução não está recebendo o áudio. Não estamos conseguindo fazer a tradução, não estamos recebendo o áudio. A tradução pede desculpas.
Vai lá reclamar, amigo.
Retirement, so probably I will go in the same direction, but for the time being, no. But
A tradução pede desculpas mais uma vez, mas não estamos recebendo o áudio.
let me tell you that after many years of attending COPs and begging, seeing now this alignment between the global plan of action of WHO, the Belém Health Plan of Action, and is really something that gives me an enormous satisfaction. Think about the fact that here we are not fighting for climate change exclusively, which will be already a very big mission for all of us. Here we are fighting for public health that makes sense, for putting in place a massive primary prevention strategy, helping the countries to do the healthier choices, which are the same for fighting the causes of climate change and the same for preventing diseases and creating a healthier environment. And we are fighting as well for making sure that the health systems of the 21st century are the ones that we need to confront this huge challenge of climate change, but to make sure as well that our citizens will have the health systems that fit the 21st century, with digital medicine, with all the ideas that I have been hearing, the labs. So this Belém Health Action Plan is perfectly aligned, is very much committed. I think I'm very much convinced that this is now unstoppable. Now we are bringing the health argument at all of these negotiations. So I'm so much convinced that now the speed for action, the ambition, and the results is irreversible, unstoppable, and we can all be very happy of. But of course, don't relax, don't reduce your expectations. There are no limits in the ambition level for public health. You need to maintain a very, very high level ambition if you really want to see satisfying results. But I think I can go now on a very happy mood because I see that we are perfectly aligned, that you will be delivering, that the nice people that is in that panel that I know all of you personally, so I know what I'm talking about. You are wonderful people, those who have been supporting this conference, and most importantly, the teams, the people, the human beings that have been able to push this and move this mountain, because it was a mountain, but we have been able to move it. Don't give up, keep pushing, and make sure that you are extremely ambitious at the COP30. There is nothing better we can do to fight inequities than making sure that people will have a good Belém Health Action Plan, and I think we are there. Of course, ATACH will be the platform that will facilitate the implementation, the monitoring, the results, keeping us satisfied. And I will be watching. And I will be watching through all my channels, through all my spies. So please don't give up. Don't reduce your engagement. Thank you so much for this wonderful opportunity. Thank you, of course, to the best team in the world. I don't want to give all the names. I think you know all the team that works in WHO, plus the big family of the climate change. Thank you so much to all of you. It has been a real, enormous, fantastic privilege. I've been very blessed to work with all of you, and I wish that any professional in the world will have the same luck as I had. Leaving not only colleagues, but plenty of friends, committed, passionate people like me. So please maintain that passion. Thank you very much. Love you. Don't give up. Ciao. Thank you.
Thank you. And I know I'd like to ask Bruna Cerqueira to give us, I think this is a very important talk, and now she's also engaged with the emotional part of our conference, but to see how much we really put our souls into it. And anyone working in public health knows best. Anything we really put in motion, we do it with our hearts, but we also mobilize, because we know the only way to getting there is mobilizing. So we are doing that, and we are bringing our history and our experiences to put all together, all in one direction, to climate change in health. So we expect great things from COP30, and Bruna will tell us the way to do that.
Thank you so much, Agnes. And it's so nice to be with you. It's so special, actually, to be able to listen to what you have been doing the whole day, and so unfair for me to go after that. That is not fair. But what I will maybe do is play the bureaucrat role. After we had, the fire up, what do we need to do? Then maybe I explain a little bit the how we can put that into practice, how we can deliver on that ambition on our road to COP. As Agnes said, I am Bruna Cerqueira. I am working in the COP presidency team. I'm coordinating the action agenda, so hopefully setting the space for the voluntary action and how we deliver on implementation. And it's so exciting to be here, because Anna Tony came back to the office this morning after she was here, and she told me, this is the action agenda in practice. You're already doing it. Everyone is here. What we have envisioned in terms of bringing the initiatives from the past to fold, you're already doing this. And so absolutely the health portion of this is under the leadership of our Ministry of Health. We have our special envoy on health here also with us. We are just providing from the COP presidency a bit of the pathway and the ways to do this. The way we have designed the action agenda for this year is a bit shaking up what we have done in the past. We've had now 10 years of the action agenda happening since the Paris Agreement, with high-level champions appointed, the subnational governments, private sector, all of these stakeholders have come in strongly. And now, I think, looking into the future, we want COP in Belém to start building the next 10 years. What do we want from now? And we are, in doing that, we're trying to respond to three main challenges. One, we want to implement, and you have said it beautifully here. It's not about making new promises. It is not about creating new things. It is about delivering on the ground, implementing, and being able to build trust in our ability to implement. When we talk about implementing, we're talking about implementing what has already been agreed. So you have done a beautiful advocacy effort to get the words about health into the global stocktake that came out of COP28. That gives us the guidance. We know what we need to do. Now, shaping the action agenda is about delivering on that. The second thing is that we don't want to build new initiatives necessarily. This is about building on what's happened in the past. And again, this is a great example. In Baku, we signed the Continuity Coalition, the idea on building on the initiatives of the past that is already being exemplified here. And maybe the last piece that we're trying to tackle is the transparency. And you've all talked about this. How do we do the evaluation piece? That is a challenge, but we do want to be able to show progress in that implementation and build trust that that is happening. So we have designed, and I think that you have seen that in the fourth letter of the presidency, a framework for the action agenda that is entirely responding to the global stocktake. We have 6 axes for the action agenda. One of that axis is about human and social development. We have 30 key objectives on those axes. One of them is about resilient health system, responding to the paragraph that is on the global stocktake. And now the next stages is how we put that into practice. What we're doing, we've actually sent out invitations today, so it should be in the inboxes of many of you. We are creating activation groups, which is basically the health activation group is this. It's already here, it's happening. It's the initiatives that have been created in the past COPs. We're bringing them together to build on them. That is the first step. Once we put the initiatives, and we will have a first meeting next week, we will ask them to, first of all, report on what they have achieved so far. What have they been able to deliver? And this will be initiative by initiative, so they will have different points, but it's about reflecting on what we have been achieved in terms of impact. And also, what are we planning for Belém? We will also ask the initiatives to help us build the granary of solutions. So I think here in the panel on the 3 solutions, we've heard of things that are happening on the ground, solutions that already exist, case studies where that's being implemented. Sometimes it works, sometimes we have challenges, we learn from them. We want to give visibility to all of this that is already happening. So we're just creating the space within the COP presidency. It will be a website, it will be a social media campaign to give visibility to these solutions. And that will be a big part of the narrative of our action agenda. Solutions exist, solutions are there. Let's work on the solutions on the positive side, on the opportunity side. And finally, we will look into the future. So we will ask the initiatives to work with us on the future. And this is exactly the Belém Action Plan, again, embodies that. So what we're asking people to do is, where we have solutions that exist and that are working, why are we not able to scale up faster? That is the key question. And so these plans, we're calling them plans to accelerate solutions. They should be entirely action-oriented. We know what the solution is that we want to accelerate. What are the action points? Who needs to do this? Is this the country-level government? Do we need subnational governments? Do we need private sector? Do we need the finance sector? To do what? When we're talking about financing, what exactly finance do we need? Do we need a country-led instrument? Do we need an MDB-level instrument? So that we're quite specific in terms of what we need to do. And of course, a lot of this is country-led, but what does it make a difference for us to do collectively and internationally? Those are the things that we want to use COP to advance. So we hope that as we leave Belém, we will be able to consolidate, what has come out of the last 5 COPs on the health sector and the results that came from that, but also that outlook into the future. And that is what we would be keen to work with you on. How this lands in Belém. So we will have thematic days, which will be announced soon. We will have an action agenda area. We will have 6 thematic rooms, 1 for each of the axes of the action agenda that will be working through the 2 weeks of COP. And there we will be taking the programming of that will be entirely led by the activation groups. So these groups that are being created from the initiatives. So we hope that the best things that are coming out, we're able to showcase. We will elevate the big announcements into presidency-led event. I'm sure we will have one with the Ministry of Health that is led to present the plan of Belém. And so we hope to leave that as a legacy, and we hope for continuity in the next COP. So a crucial part of these plans is, where do we house them? How do we make sure that they're not only something that we're announcing at this COP and then we never see it again? So it needs to have a monitoring system, a secretariat in place, so that we continue to go and base it on the existing initiatives. So I will stop here, but I'm so excited really to be able to witness this, and this is really, the work is entirely in your hands. We're just here to support and give you the stage, hopefully in Belém, to be able to announce beautiful results.
So, thank you very much, Bruna. I think we got the message now, right? I think we have a lot on our shoulders, but I do believe we can do it. So I'm really excited with all this, and I'm really, really happy that we are aligned from the beginning, so we don't have to adjust anything to fit in. And that's the first time, people. So I think I'm really happy. And I think we can now work in the next 2 days concentrating on what are the solutions that are scalable and that we need to take global. And that's what we need, because that's what will make the plan something that is real. And I had mentioned to some people, for anyone working in health systems, we know things don't just start from anything. So we decide collectively. And normally you have some leadership, but that's a decision. And some of you probably just studied that, but some of us lived through it, like when we decided that primary health care was the way to go. It's a decision, and then we implement it, and then the whole world talks about the same thing. We need to do this. Now, what is our voice in the climate change discussion? That's our voice, and that we just get there. So I'm quite sure at the end of the 3 days we'll be a step further, and you'll have that voice that will be heard the whole world, and we'll make it so loud nobody will ever say they didn't hear about it. So that's it. So now we are going to celebrate, and I believe we have some news about the reception, so about celebrating, and then all the talks we could not have during the day because most of us were just listening. We'll have the possibility to know each other better and enjoy a little bit what we call, it's just a little bit of what Brazil has to offer in terms of culture and some surprises. So thank you. Thank you for the groups and for everyone who participated in the discussions today.
Please, my microphone. Once again, okay. That's perfect, Mrs. Agnes. You are correct. And we invite all the authorities for one last picture. While this, agradecemos imensamente.
Thank you for all the participants. Our special recognition to the institutional partners that support this initiative. This strategic dialogue is crucial for COP30 to reflect an integrated action plan. Before we finish, we invite you to participate in a reception and a cultural event to show you the Brazilian culture. For those who want to get more information, we will show a QR code with. Please go to the restaurant, and because the cocktail will happen there, we will have dance events.
We're gonna have live music and dance, and don't forget to return your devices from the translation. Good night.